I'll call the meeting to order for the county board. If you didn't check in, please check in so we're all present. I see we're missing Sandy and Deb yet. Bill? Not working? Help is on its way. Okay, you just marked. And I see Deb is here, so you can put her down as present when she gets logged in, yep. And, okay, now Bill's working. So the only one we're missing is Sandy at this time. Okay, we'll start with Pledge of Allegiance and a moment of silent meditation, and then please, in your thoughts, consider all the people in law enforcement. And I was going to make mention too that we have Kimberly Leffel is here today, but her grandma just passed away, and Bill Swatala's dad did too, so keep them family members, if you could, in your thoughts and prayers. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. Item number 3, approval of the minutes from January 27th, 2020 meeting. Is there a motion to approve? Motion by Randy Young, seconded by Gene Hoppy. Are there any questions or comments? Seeing none, then we can do this by acclamation. All those in favor say aye. Aye. Opposed, same sign. Motion carried. Public comment. Is there anyone in the back wishing to speak? Okay, seeing none, we will move right on. Item number 5, motion to deviate from the order of agenda if necessary. Motion by Deb, seconded by Gene. Once again, we can do this by acclamation. All those in favor say aye. Aye. Opposed, same sign. Motion carried. Okay, chairman's report. I have, well, in case a few of you didn't know it yet, we interviewed for TS, and Matt is here. He is now our new TS director. So we just filled that from within, and not because he was here. He was the best candidate out of the lot that we had to pick from. You will also notice we have some changes going on. At our last executive committee, we appointed Jimmy as the interim coordinator. We took our applications the first time around, interviewed, and we thought we would be able to come up with some better candidates. So we extended the period, and when we extended the period, we had another round of people that we interviewed, and it's kind of funny because we did have what we thought was an excellent candidate the second time around, and we did make him an offer, and the individual had many questions for Rachel about the benefit packages that the county has, and she even informed them that it was negotiable. It wasn't written in stone. And after the weekend, Wednesday of the next week, the individual sent an email that he was declining taking the position, didn't even try and negotiate. So I don't know. I don't know what was exactly happening there, if we were just being used to maybe try and promote where he was working, if he could get a little more money or not. But so we had it on the agenda to discuss, and Kathy brought it up that Jimmy had expressed interest in it the first time around. So we discussed it, and we decided to appoint Jimmy interim for, I believe it's about a 3-month period, and we'll kind of see how things go. He's got a lot of catching up and I think some learning to do. You want to give us a quick speech, Jimmy, or?
I would just say that I'm excited to do it, and I look forward to working with everyone.
Okay. I think he'll do fine. We also have interviews for the finance director position scheduled for March 5th. And if I remember right, we have 2 candidates that we picked out of ones that applied that we're going to interview and see what we come up with there for potential replacement for Nita. And you will also notice, sitting over here to my right, Tony is absent from the table. Tony had requested kind of an extended use of his vacation time, and I didn't feel that the county could go more than a week or 2 without having any corp counsel on. So we signed a temporary agreement with Tom Martell, and some of you who are longtime members like Arlen probably have seen Tom in the past. He worked for the board before. And okay, yep, see, we're hearing all good things already about you, Tom. So, and he just said he's setting in today. I asked him just in case there was any big questions come up, but I don't think we have too many issues. Nothing that's real controversial. So, I guess we are about done with the chairman's report, except for we have a few speakers. And she is not listed on here, but Teresa Harmala, will start with her first. She's got a little update for everybody of what she's been working on since the last meeting. And to me, it sounds like some good news. And I promised her that nobody would beat her up too hard today either, like the last time.
That was a stipulated, well, no, they weren't bad last time. So, so we're real excited that we are finally at a point where we have created a sustainable system, because again, like I had said last month, that we're looking at a vaccination clinic that would be weekly and sustainable without necessarily saturating our team in the office, because there's other things to be done. However, we will definitely be involved every time we're there. So it'll be on Thursdays and Fridays. The vaccine has a limited amount of time that it can be off-site. So we will work within that time period. We've created a system where it's just a link that you will have on our website, on Facebook, probably on our county website, you know, as many people as we can get in to schedule. We have 100 vaccines right now, and we're doing a soft start this tomorrow and Friday. And what I mean by that is we have the system for scheduling. We also have the team that we hired. There's 5 nurses and 2 EMTs that will be able to support the clinic. So we're having an orientation with them in the morning, and then in the afternoon we have 40 that we have 100 total, so we can do 40 tomorrow and 60 on Friday. We are slotted to get 400 next week. That is in compliance with the state, getting our educators taken care of, but also balancing that with our 65 and older and everybody else that we want to get in there. So that's great news. We're real excited about it. We have been working with Menominee Tribal Clinic as well as Stockbridge Muncie has been incredible with getting people through. So we're really partnering and finding those providers that are starting to get the vaccines in. Gwitt Pharmacy, and there's a couple of others that I want to reach out to so that we can have a network of people. We don't care who's poking the arms as long as it's safe and given to the people that want it.
And then hopefully this will be continuing correctly.
We wanted to make it sustainable for about 3 to 6 months, and it should be all of that.
Yep.
So, until we get to a point where it's manageable.
And there's no guarantee of the allotment you'll get.
Yes, I'm really glad you brought that up. So the way with the scheduling, we're working with the scheduling on a week-to-week basis because that's when we know how many vaccines we're going to get for that next week. So if I find out on today what we'll be getting next week, then I can open up that many slots for scheduling. Like I said, next week is a little bit with the schools and balancing what we have left over. However, Stockbridge Muncie, like I said, has really supported the school systems as well. So hopefully we'll be able to get down that list.
Okay. You have a question, Jerry?
Yes, I do. I know I brought this up last month, and I'm going to bring it up again, simply because I've had some elderly people contact me who are older than me that said they don't have a computer, they're not on Facebook, they need a phone number to call here at the courthouse or someplace, and that information has to get out to them so that they can see it, because she said she's been trying to get a hold of the nurse's office, but there's been no, quite honestly, help, she said, because they haven't gotten any answers. So what can be done as far as communicating with the people out there that are not online?
Right. And I'm glad you brought that up. I don't know. We do have a list of about 70 people that we're reaching out specifically for this, tomorrow and the next day. So I don't know if she's on that list or not. But if people are calling in, and I was really kind of thinking about, can we recruit or talk to maybe a library or somebody somewhere where they could go to find a computer? And the only reason I'm saying that, because I thought about, we thought, okay, people can call in and make that appointment. Well, by the time they call in, everybody else that can be online is going to get those appointments. So that didn't end up being the best way to do it. However, I know my staff has been taking names, so my apologies, and maybe we can get together, make sure that we've got that person, but we've really been trying to create a list so that we can go down that list. Another option as well when we're calling people, and if we don't have an appointment available, then our question is, if an appointment does become available while we're doing this, say somebody doesn't show up or is ill that day or whatever, can we call you and would you be available in the next 30 minutes to come in and get that vaccine? So that's another option that is present too.
Okay. And I believe the ladies in Ag and Extension are going to help you out with some of the phone calling and that, or is that no longer part of it?
Yeah, because of the appointment thing,
Yeah.
it ended up not necessarily being the best way to reach those people. But I'm working with Aging Resource Center and whatever partners that we have to work out. We do have a couple of volunteers, and Extension will be helping with that. So they're going to be able to kind of be support staff for the rhythm and flow of the vaccination clinic for this week.
And you are going to put out, you had told me the other day, a press release.
Right, yeah,
Once you get this up and going.
correct.
So it will be in the paper and on the radio.
Correct. We really want to get this week, just kind of getting that soft kinks out of there so that when we do a press release, which will be next week, then we'll have solid information.
Okay. We have a couple other people who have questions for you. Marvin?
Yes. Is Shawano County just limited to a certain number of doses? Because we've we're one of those, like Jerry said, are trying to call in. We always get the information, sorry, there are no doses available. And we would be qualified, my wife and I would be qualified much sooner, but no phone calls accepted?
Well, I'm not quite sure about your situation, but as far as the doses that we've gotten so far,
Are you talking about we? Are you talking about the Shawano County
department.
Health Department?
the health department.
Okay, thank you.
Yes, thank you. Yeah, the health department, we had received 200 doses. We were not quite ready to be up and started. However, we did reimburse Menominee Tribal Clinic because they had been doing Menominee County folks as well. This is our second dose. I asked for 200, I got 100. So not everybody's not necessarily getting what they're asking for. I had asked for 450 for next week. I got 400. The state is really working on trying to get these numbers up all the way around. I know Theta Care has been back and forth. They have them, they don't have them. They have them, they don't. GWIT as well. Yeah, I know. I mean, they're calling me like, what can we do better? And it's like, well, get us our doses when we're asking for them so that we can get them out.
Okay. And possibly another way to, there is going to be a phone number that they could call in on?
I honestly think well, and I'm going to talk to TS again. We had talked about a hotline for that so that the phone number goes directly to COVID rather than getting filtered amongst all the other calls that we get. So it would, talking to TS about that.
Okay. And I would suggest then too, as soon as you get that done, if you do have a number for that, you could pass it along to the radio station. And that would help to get the number out for more people of where they can call to start getting some answers.
Absolutely.
Okay. Gene Hoppy.
Yes, I was wondering, is New Cap helping you at all?
There was some hiccup with our first conversation was really good, and thank you for that referral. For some reason, and it wasn't me, it was one of our other staff, but when they had tried to reach out again to follow up, I don't know if he had the wrong number, but they had said that they had not gotten any connections, so I sent that email this morning, so we will be working with them.
Second is that Dr. Rai is on Channel 2 on Tuesdays and Thursdays. And if you've got any information about when you're going to start and everything and phone numbers, call Channel 2. It's all free information, and you don't have to pay for this. And all the stations that you can call in, that's free, and you can get that on the air so people know that we're doing something in Shawano County for the people.
Absolutely.
And I think that's really important, you know?
Yep. Yeah.
Okay.
Go on.
Pardon?
Oh, were you going to continue, or were you done?
No, that's it, Gene?
That's it.
Okay.
Okay. I
yeah.
do plan on that.
Okay. Deb Nofke.
Same comments that Jerry had with elderly folks that'll call and say, I can't get through to anybody at the health department. Are they doing anything? Not everybody gets the paper. Not everybody's online. As far as call-ins, why don't you put those people on the list for the following week?
We do, and that's what we plan on doing. I'll be honest with you, when I look at our phones, we don't have messages on there. So if we have one person in the office answering phone calls, and that might be something that we can work with extension with the hotline and that kind of thing. But if people leave voicemails, we do follow up with those. And I've not seen messages on our phone that have not been addressed. So I'm not quite sure where the disconnect is with
Okay.
that. But
And
we are
then-
taking names and we are taking a list.
And then the other question would be is, do you foresee doing a standby list to tell people, okay, you're on standby because all the slots are filled,
Yep.
but if we have extras, I mean, is that a possibility?
That's exactly what we're doing. Yes.
Okay. Aaron Damrow.
Where is this happening?
Great question. It is at the Lakeland Center for as long as we have it available. You will come in the entrance. There will be a traffic control person there. They will hand you a clipboard with the information that we need. demographic, are you sick today, those questions, and also the information about the immunization or the vaccine. Then you're going to park in front of Lakeland Building, just the nearest parking, and your time of your appointment, after you get your paperwork done, a sticky note would go on your windshield. I guess Culver's does this, but then we have another processor that would be looking and manning that and calling in one by one. They will ask those questions again, verify information, and then escort them to a nurse. We have 4 nurses that are giving vaccines. The nurse will go through her processes, and then after that, we have a runner that would take them over to the observation area. We have 2 EMTs that would be doing the observation, and we have someone that will be scheduling their next appointment for the second dose.
So it sounds like you're getting it set up for the Lakeland Center, but is there any plans to expand the clinic to the other parts of the county for the elderly people that don't have the ability to travel?
Sure, and I had a conversation with Heidi Russell this morning, and we're kind of hammering out what that can look like. I know Theta Care had been kind of kicking around some things, and again, because this is so structured, we really need to do it where it's sustainable and not a knee jerk where it's like, well, that didn't work or somebody had a problem. So definitely in the talks of that's our next step. This is what we need to do next.
Okay, because there are community centers in Burnawood, in Wittenberg, in Tigerton that, I mean, probably have enough space to
Right.
do something like this. And
Right.
there's a large population that doesn't have the ability to get anywhere, so.
Right, and we're in special needs is another population that we're considering on, okay, what do we do? How do we support that?
Thank you.
Okay. All right, I see no other questions, so I guess thank you very much, Terry, and stay on it.
We'll keep up.
Keep moving ahead. Okay, the next item I have on the chairman's report is there has been some discussions about drug court between DHS and a district attorney and the judge. And DHS is afraid that if we don't get things improved, we're not going to get the funding from the state the next time around. That basically drug court is failing. So I asked each one of them to be here to provide their side to us of what they see and what they think is missing. And then it'll be up to us to decide how we're going to proceed. I guess we'll start one at a time. And why don't you come up, Becky, I believe, is here for Health and Human Services.
Hi, I'm Becky Edgren. I'm the Drug Treatment Court Coordinator for Shawano County. The DHS board had asked me to come to the meeting today to give a background regarding the drug court program for those of you who are newer to the county board. Just to give you a little information about what drug court is and then how it got brought to Shawano County. And then also we'll talk a little bit about the successes of our program so far and then just some of a couple concerns that have been brought up. So, there was a formal resolution that was drafted and unanimously passed at all committee and board meetings, with the final county board decision being made in August of 2017 in support of developing a county adult drug treatment court program. The adult drug court program was selected by the Shawano County Board due to the presentations provided, which show the cost savings and overall excellent outcome that's proven by research, showing drug courts to be more effective than an offender just sitting out their sentence in jail. Through the adult drug court, participants receive lengthy treatment programming and intensive case management services that help them to stay sober and to build productive lives for themselves and their families. But they also are held accountable by a judge to review their progress throughout the program at least every 2 weeks. They're seen before one of our judges, and then They receive rewards for doing well and sanctions for not living up to what the obligations are that they've agreed to with joining our program. The National Association of Drug Court Professionals states that research has proven that drug courts work better than jail or prison. They work better than probation and better than treatment alone. Drug courts significantly reduce drug use and crime and do it cheaper than any other system, any other justice strategy that's used with these people. So adult drug courts are built around the premise of a specific target population. You can't just accept anybody into the program because it's not going to work for everybody. The target population is high-risk, high-need offenders, and that's been proven by national research done over the past 30-plus years regarding drug courts. The research has proven that without the intensive treatment and programming, nothing will change with these offenders, and the cycle of recidivism is going to continue with them. So high-risk individuals are those individuals who have already failed at jail or probation, most likely continue to commit crimes related to their drug problems. High need means that they've been diagnosed with a moderate to severe substance use disorder. So that means that we're not enrolling those who are dealing drugs to make a living or a profit off from it, but those who are actually drug dependent and in need of treatment. Low risk or low need individuals are successful with just probation alone or treatment alone, which is one reason why they're not the appropriate population to refer to drug court. Some things that we know about drug court. Drug courts are the most effective strategy for combating methamphetamine addiction and work better than treatment alone. That's a huge problem in our county, methamphetamine addiction. Imprisonment has little effect on drug abuse. Research has proven that drug court's effects on crime can last for years, if not decades, which in turn affects the money spent in housing offenders in jail or prison. Drug courts save taxpayers considerable money. So studies have shown that the average cost savings ranging from more than $4,000 to more than $12,000 per client. These cost savings are due in part to reduced jail or prison costs, reduced revolving door arrests and trials, and reduced victimization. For every federal dollar invested in drug court, $4.30 is leveraged in state funding. So in Shawano County, the DHS levy dollars that were saved from our TAD grant that we received in 2020 alone was $37,325. And the program has had an estimated savings in incarceration costs of over $210,000 since starting it in 2018, with like jail costs for keeping the people there instead of bringing them into our program and having them go through treatment and the intensive case management. If filled to the capacity of 20, it could have saved $401,500 in jail costs in 2020 alone. Our county will continue, well, if it were that we lost the grant, our county would have to continue funding the drug court program without that grant money if that were decided by the board to keep it on if we lose the grant. So currently we have 8 participants enrolled in our program, and our capacity is currently 20 participants according to the grant. Since the program began in October of 2018, there have been 55 referrals, 15 enrollments, and 6 terminations of those 15 enrollments. We had 31 referrals in 2019 with 7 enrolling. In 2020, we had 13 total referrals to the drug court program, 5 of which were from probation. We've received 1 referral over the past 4 months, and that was an ATR referral from probation. And then our last referral prior to that was received in October. So currently we have no referrals waiting to be screened in. The best practice states that all cases meeting minimum eligibility requirements should be screened for risk need levels and substance use disorder diagnoses, and then the team determines acceptance into the program based on the results of this clinical screening that's done. And then also, so it's based on the results of the clinical screenings done and the legal screenings done by the DA and law enforcement. Minimum criteria to get that person to the screening process is they need to be a Shawano County resident, they need to be available for adult jurisdiction, and they must meet the requirements, the minimum level of charges drug-related to be eligible for the program. Through the current process, new cases not referred by probation have to be approved by the DA's office prior to even reaching me for that screening process. So that's a little bit of the concern that was brought up by the Department of Justice in relation to the grant. That's who oversees the grant that we receive, is the Department of Justice. And the program manager and I spoke, and she said that if things don't change with our referral numbers, our admissions, and having the proper kinds of admissions, the high risk, high need admissions into the program, they can't continue to justify giving our program money, and we'll lose about $107,000 in TAD grant that's used to operate the program every year. We did not use almost half of our grant funds for 2020, partially due to not getting the referrals and admissions needed to expend those grant dollars last year. So we kind of lacked there. And that was kind of the concern with the TAD grant program manager. Current program successes that I'd like to share with the team or with the group here is that we had our first drug court graduation that took place on September 1st. This individual remains an active mentor in our program now, and he's trained as a peer support specialist and recovery coach. We have 2 more participants who are within 1 and 3 months of graduating, one of which is also a trained recovery coach. 2 participants are working full-time at Saputo Cheese, making $20+ an hour, both of which were unemployed prior to joining our program and had heavy drug addiction issues. 5 are working part-time to full-time hours in local Shawano businesses. 1 is currently at Residential Treatment, who just joined our program, and that's funded solely by the Drug Court TAD grant. 1 participant is enrolled in GED classes at NWTC, and another is registered to begin those after her treatment group concludes. 1 is enrolled through a full scholarship to start NWTC's nursing assistant class, and is also registered for the fall semester's licensed practical nursing program full-time. 4 are single parents who are currently in the process of regaining full custody of their children. 1 is a single parent who has full custody of her child, and she's meeting the requirements of drug court while managing as a single parent. And then 2 participants have developed a local weekly Narcotics Anonymous meeting after seeing the need in Shawano for more recovery support group meetings. So that is just an overview of the program, some of the successes, and a couple of concerns that we have.
Okay. We got Teresa.
Hi, Becky. I have a couple questions after all of the information that you gave us, and I appreciate all of the information, but I have a couple questions.
Sure.
If you were given the approval by the county board in August of 2017, why did it take until 2018 October, 10 months later, to get the program moving?
Because that approval was just to begin forming the program, and then so over the next year, there was a committee, like a task force that worked to build the program, build all the policy and procedures related to it, attend trainings, multiple weeks of training in, I can't remember, out of state, Idaho, I believe, where they went and trained with another drug court team that's like nationally known. And then also just multiple trainings with the National Drug Court Institute and the National Association of Drug Court Professionals, so that they could ensure that our program is following the best practice standards that are set in order to get the best outcome.
Okay. And we were advised that on September 1st, 2020, you had your first graduate. So we're almost 2 years into the program before you have a successful person. My question is, how long does the program take to get a graduate from it?
So it's built, originally it was built being an 18-month minimum for the program. However, we reviewed in the last year the best practices and reduced that to a minimum of 14 months. But they have anywhere from 14 to 24 months to complete the program. When people enter the drug court program, they're not, you know, they're actively using drugs most of the time. And so it takes a lot of time and effort and treatment for them to get to the point where they're actually meeting the benchmarks that they need to phase up. There's 5 phases in the drug court program, and they have to go through each phase. There's a minimum number of days in the phase, a minimum number of requirements that they have to meet for each phase, and then also we test them for UA drug testing at least twice per week, if not more, throughout the program, which is also funded by the TAD grant. If they have any slips or relapses, people sometimes have to go to residential treatment, or it may set them back in their progress going through the program. And so we often see that, especially in the first 2 phases, they're just starting to be able to stay sober and follow the requirements. But then as they get to like the 3rd, 4th, and 5th phase, they're becoming like active members, not only with their treatment, but they're getting employed, they're going to school, they're getting their GED, which they didn't have because some of them started using at 15 or younger and have been actively using drugs since then, so.
Okay, and you also said that you did training in Idaho. I think it would have been more cost-effective to go to Brown County and
I believe that
mentor
was
them.
paid for by the National Drug Court Institute. They pay for all of that training, and they pay for the travel and everything.
But what works in Idaho doesn't necessarily mean it works in Wisconsin.
Well, the standards that our program is based on is national standards, not on state by state or local standards. It's an evidence-based program nationally, so. I wasn't here during that.
Yeah, sorry,
period.
Becky wasn't our first coordinator. So we did travel to Brown County, Marinette County, Manitowoc County, Portage County, Brown County on multiple occasions. So we did visit many other local courts, as well as during the process of creating our policy and procedure manual, we thoroughly reviewed what other Wisconsin programs are doing.
Could you state your name, please?
Jennifer Frost.
Thank you,
Sorry, I
Jennifer.
wasn't here during the development of the program, so thank you, Jen.
Thank you.
Okay, is that it, Tess?
Yeah, I'll let someone else talk.
Okay. Marvin, you have a question?
2. One, you stated a whole lot of numbers that went over my head. What I want to know right now is, according to your latest numbers, how many are actually enrolled? And secondly, you mentioned something earlier in your report, the lack of referrals to the program. Who does that refer?
So referrals can come from numerous resources. The district attorney's office, the public defender's office, defense attorneys outside of the public defender's office, law enforcement, the Department of Human Services, family, people can self-refer themselves, various sources. But when a referral comes in, the way that our program policy is set is that before I can start the process of treating it as a referral, it has to be approved by the district attorney's office and law enforcement, which is different than most counties in the state because Usually, the referral would come in to me. The district attorney and law enforcement would complete the legal screen at the same time as the coordinator and treatment provider complete the risk and need assessment that's determining them to be appropriate for the program in that aspect. And then also that they have a moderate to severe substance use disorder that needs to be treated through drug treatment court. Our program has currently 8 active participants with a 9th one that was referred by probation that will hopefully be enrolling by next Tuesday. So 9, hopefully.
Kathy Lubke.
Okay, if I remember right, we were one of the last counties not to have a court.
One of 7
One of
in the
7?
state. Mhm.
Okay, here we're, what, 2, 3 years into the program. We have a chance of losing our grant money. Is there any other counties that have this same problem? Or is this a unique problem at Shawano County?
Well, when I spoke with the project manager, the program manager with the Department of Justice this morning, our program has just a lack of referrals coming in that's different than many other programs.
So it's
Yeah.
something unique to Shawano County that needs to be addressed.
There was one other county that ran it the same way as Shawano County does, that's Walworth County, and with kind of the DA being the person that says yes or no, they can be screened. And that's the only county that they said runs it that way, or has run it that way.
Okay, so I just think some people need to get on board on this, so thank you.
Okay, Aaron Damrell.
So I guess what you're saying is the DA is the gatekeeper to the drug court right now, whether, I mean, that's the kind of gist of it.
So we can get referrals, probation can refer people as alternatives to revocation, and that process doesn't have to be approved by like the DA's office in regards to whether we can screen them or not. The whole team does still decide on ATRs whether they're going to be enrolled into the program, but for people that have new cases or new charges, that is how I get my referrals currently. That's how I got the 8 of the 13 referrals came from legal counsel.
So drug court is it's like a team-based court, and you have the treatment provider, you have law enforcement, you have the DA, you have the public defender's office, you have the Department of Corrections. You have a lot of people involved that are making decisions on how to operate the drug court,
Yeah.
right? And I mean, in talking with the drug court down in Wapaka County, it sounds like somebody, if they have a candidate, the DA does not get veto power on saying that no, that person cannot be screened. It's whether or not the participant, the offender is a high risk, high need individual. And I mean, the screening that they do down there is, I mean, if you're statutorily ineligible for drug court based on a prior sex offense, then you can't get in. But that should be the only legal reason that somebody should not be allowed
To be screened.
to be screened for drug court. Is that the best standards for operating a drug court?
The way that they do it here or Wapaka County, is that what you're saying?
I mean,
The best standard is, like what I had explained, best practice standard is that we don't exclude anybody that, well, for our grant purposes, we're not allowed to have anyone that has a violent felony or misdemeanor, like a current felony or misdemeanor offense that they're waiting to get charged with. And then, yeah, I mean, otherwise what's supposed to happen is that we do screen everybody, especially in regards to the whole equity and inclusion thing. We're not supposed to be subjective, like saying, oh, well, so-and-so did this, so I don't think he's going to do well in drug court. We're supposed to be objective and focus it on the assessments that are actually done to know if they have the high risk for recidivism, the high need for treatment.
And this is what is happening all across the United States, is people, to make these courts successful, is they're following this stuff. I mean, you're looking at assessments and, I mean, following these practices, you're not looking, I mean, I don't think this person should be in drug court, or it isn't a personal opinion, it's science.
It's objective, yeah, and, yeah, that's, the best practice standard is that high-risk, high-need offenders are brought into the program, and they're screened through eligibility screenings.
So as a first-time offender for, let's say somebody gets picked up for methamphetamine for the first time, their first felony offense, maybe they had a prior misdemeanor, like prior THC. I mean, a first-time offender, first-time felony drug offender, are they an appropriate candidate for drug court typically?
It depends on the screening. The risk screening it's the screening that the Department of Corrections uses, that we use. Go ahead. Heather is a probation agent on our team, so she might be able to talk more on that.
Let's see if this is on. Okay. I'm Heather Haflinger. I'm one of the drug court agents. I supervise Shawano and Menominee counties. I've been with the program basically since it started, like Jen. So the risk assessment that's being used for the people being put into the program is the COMPASS risk assessment. And for somebody like what you're talking about, most likely will not be high enough risk on that assessment to be placed as high risk, high need. And they look at number of arrests. They look at if there's a violent, if one of the offenses is violent, which we can't put them in the program already. They look at if domestic violence is involved, you know, stuff like that is some of the like static information. So those people alone, most likely, now it's not all of them, but most likely will not be appropriate per that assessment alone. That's not saying they may not have like a substance abuse diagnosis, but and we've had some of them where unfortunately I think the last one that was put in the program, when she was first assessed, that's what happened, was she wasn't high risk, high need. Unfortunately, she got more offenses, which then she was reassessed, and she was then appropriate for the program. So then that's how she got put into it. So there's multiple assessments being done, mental health assessments are being done, and that's how we get a lot of these people eligible. For Department of Corrections, we use it all the time for ATR, for alternative to revocations, because right now they're trying to minimize the amount of people we're sending back to prison, obviously, and we're using more community-based treatment. So why not use this stuff here? I know as a Menominee County agent as well, that we have a lot of people going back and forth. So we do have the ability to waive the resident stuff if we're able, but that's a big struggle. I know there's a lot of people who have Kashina addresses that are having issues in the court system, but they're not technically eligible. So that might be something that we can maybe talk about. Is it appropriate for a waiver? Is it not? You know, stuff like that, because there's a lot of people there that need help.
So Menominee County residents aren't eligible for Shawano?
Because it's a Shawano County Drug Treatment Court program.
But
So,
it's the Shawano Menominee District Attorney, Shawano Menominee.
well, I agree with you. I completely agree with you. But yes.
Menominee County's funding the court system here.
So that's basically a talk that's been talked about for 2 years, that how do we get that on board, like everybody on board? And that's way above me. I'm not sure how that happens.
Okay. Well, we have two more people wishing to speak, but we're going to have to keep moving along because there's other people that want to make some quick comments too, and we're not going to solve the issue here today all the way. Gene, real quick, please.
Yes, it's one thing, if we're on the brink of losing our money, what are the reasons they're giving you that you're going to lose the money? So that you can work on those things and gain their support. If you're doing a lot of other things that is not taking care of the problem, you're still going to lose. You've got to go after the problem.
Okay.
And you're not doing it, it don't look like.
Sorry. Yeah, the information that I've gathered from the grant manager is that we need to increase our referral numbers that we put into a database, so they see we're actually looking at people and screening the people for this program. Not all referrals are going to make it in. They have to meet the eligibility requirements and the team consensus to let the person in. But so referral numbers need to increase, admissions into the program need to increase, and then the proper kinds of admissions need to happen. They monitor all of this by information that I put into a database through the grant system. So they're constantly monitoring how our program is doing, and they've already earmarked our program.
Okay. Deb Nofke.
Okay, I'm confused here. The first-time offender that's obviously got a problem but finally screwed up big enough to actually end up being charged with something, that person you won't help?
That person may be able to they're considered lower risk, most likely, and they may be able to get their help through a less intense program, a less expensive program, such as probation.
If we've got grant dollars just about to go away and we're not utilizing them, why wouldn't you try to stop a recidivism cycle, even if you see somebody that's just entering it?
Because that doesn't meet the high risk, high need requirements that are required by our grant.
And the state does review them, correct?
Yes, they review it quarterly when I submit my reports, and our DHS finance office submits their financial reports as well.
Okay, and why are we one of the few counties that has somebody that has veto power, or, for lack of better terms, that sounds like what it is? Why do we have, how's the DA supposed to know if a person qualifies for this? I mean, really, maybe law enforcement could figure it out if they're picking up the same person time and time and time again, and they're always out of it. But why are we going through that procedure?
I don't have an answer for that.
Well, that's,
somebody's got to.
that's the reason we're here today, Deb. To get started towards an answer.
Well, maybe
Okay.
we should just change that. And why in the world wouldn't
Well-
we partner with Menominee County? It's Menominee County, Shawano-Menominee County court system. We share the courts, we share the jail.
There's lots of things that have to be answered to correct this.
But
Let's.
we've done it with the buses, White Lightning and Blue Streak. We were able to leverage our grant money, and the tribe was able to leverage some extra. We did it with the health department.
Yep.
Why would you?
So it would have
It's
to be
6 miles
agreed
away.
upon by the counties, but it has been done where counties that do have a treatment court program serve counties that don't. But it's got to be an agreement between the counties, and that would have to be looked into a lot deeper on what
Menominee
it all
County might
entails.
be able to get some grant funding too, especially if they're going to partner with us. I don't see why we wouldn't try to do that. It's just like a no-brainer.
Well, we're gonna move along because we have two other individuals that are involved in this. And I would like them to have a chance to speak so we can all hear their side. And then I'll give you my suggestions so far of what I have learned with all of this. Would you like to come up, Mr. Kistel?
Good afternoon, everyone. My name is, I'm Judge William F. Kissel, and I'm the Branch 2 Judge for Shawano-Menominee Circuit Court. And I'm also the Drug Court Judge. And to give you just a little history, some of you may know me because a number of years ago, I was one of the presenters when there was the interest of having a drug court. And one of the reasons that I was invited to speak to the committee or to the board is because I was prosecutor for a number of years up north on the Menominee Reservation at a couple of different times, and I was the drug court prosecutor. So I had experience in drug courts for a number of years, and we ran a drug court up north for a number of years. It was funded through a grant as well, but it was funded through a federal grant. So I had that experience, and we were able to see how the treatment works, and how some of the advantages of drug courts, some of the problems that can exist. So a number of years ago, we started this drug court. If I recall right, it was the presentation, I think originally came from perhaps Theta Care had some interest, Social Services had some interest, and I know I was invited, and the prosecutor was invited, and a judge from Marinette County made a presentation, and he presented his experiences with drug court. And at that time, the county then decided to set forth some funding to start a drug court. When we had that funding, we sat and I was the drug court judge and volunteered to do that. And we set forth to set up our parameters and our policies, and we met on a weekly basis with a number of the team members, including not only myself, but representation of the Public Defender's Office, law enforcement, probation, parole, the prosecutor's office, and of course our drug court coordinators. And after a long period of time, we set forth our policies and our procedures, how drug court would work. And I recall that we were cognizant, we tried to always bring forth best practices. And what best practices means those are not requirements, but is what the experts say, this is what works. This is what you should do. And best practices are used on a variety of different type of programs. And I've always thought that it's a good idea to follow best practices because someone has already done the thinking for us and says this works. So we did bring forth those practices into our policies. And one of the things I think that I will tell you, that there's always some confusion of, who's drug court right for? Who goes into it? Let me explain. And even outside of drug courts, the training we've had as judges, not even my training I've had as a drug court prosecutor, but as a judge. The training we have, anytime we have an individual come forward to us, perhaps in a criminal matter or otherwise, and we're maybe placing someone on probation and setting forth certain things they need. One of the things that we are told is when you're giving any type of help or treatment in any type of thing, mental health, drugs, alcohol, violence, whatever there is, you have to use the right amount of medicine for the right amount of problem. In other words, just like a doctor, they don't give you strong medicine for something that is not a need for a strong need. The reason is, and we are told a couple of reasons. One, if you have a person who does not have a real big problem, don't give them real big treatment. Because number one, it won't make them better, it'll make them worse. The other problem is, it obviously doesn't make any sense, and it just isn't very cost effective. But the main reason is that you can make someone worse rather than better. Now that relates also to drug use and drug abuse. So one of the things you've heard Ms. Egren indicate, and I think we've also heard Jennifer Frost mention too, is what is right for drug courts and the best practices as you hear the term high risk, high need. Well, what does that mean? Well, high risk. Someone who has a long history of drug problems and is very much at risk of continuing to use these drugs and they're addicted and they're going to have very, very bad consequences. High need is they have great need for help and treatment and for the time that is there. So sometimes we look at it and we all think, and as our gut feeling tells us, you just stop that person with that joint in the car. We stop someone with a marijuana cigarette. Aren't those the kind of people we need to get there to stop them from their drug use? Well, I think it's always good to become involved with individuals and try to help individuals who are starting off in a problem because it makes good sense. But the question is, what type of help do they need? So if the question, are they a high risk, a high need? And most likely they're not. But they may need some help. And one of the things that happens, so if typically you have someone who is a first-time offender or doesn't have a long history and they do have some possession of drugs, what the options are of the court is many times they're placed on probation and they're required to follow certain requirements such as an AOD assessment followed through a treatment. Now some of those individuals may not do well in treatment and through probation, and maybe sometimes they fail and they're at risk of being revoked from probation. sometimes those people later we find do have a higher risk because they have failed. But I want to make it very clear that the best practice is high risk, high need. These are people who need our time and our effort. Be aware that drug court is very time consuming. It's very, very expensive. So you want to make sure, and it's not only expensive and time consuming for the county and the people who work around it, it's also time consuming and difficult for the individuals who are admitted into drug court. Drug court is not a free ride. It's difficult. The people who go into drug court, their lives are controlled by that drug court team. They're told where they can live, pretty much. They can tell, they're told the jobs they can have, can they be employed, their hours of employment, who they can talk to, who their friends are, what they can do, what they can't do. They have to go to multiple meetings, multiple type of sessions that they have to go to. Not alone, they have to meet with the drug court judge on a bi-weekly basis every 2 weeks, and we go through, they have to appear in court. So there's a big investment that they have too. So this is why it's important to understand high risk, high need. These are for people who really need our help. So there is that issue. Now, I'm committed to the best practices. I think that's important. Now, there might be some concern from the people here, but what about those other individuals who may have a need, but they don't meet the drug court? Like I said, there's other options for them. One of the other options is a probationary term, and they can be sent to various treatment as a condition of the probation. There's other things that the prosecution can do. They have other abilities to do things, and I won't speak for the prosecutor. They can perhaps discuss some of their other options that they have. Now, I hear about, and I don't really take a position on referrals, except that referrals need to come in. They have to come in. That's how the process goes. Look at some of the communities. I think every community, I think, is unique and different. The question we ask is, do we have a drug problem here? Do we have people with high risk, high needs? Of course we do. Every community does. Do we always see those in court? Not necessarily. I know that in some communities they have, maybe in the cities, you'll see an individual come time and time and time in front of that judge, a judge who sees them time and time again for felony possessions of methamphetamine and heroin. At some point, they're no longer going to be sitting in a jail for 9 months. At some point, they're not going to be sent to probation. They're looking at going to prison. And prison for a lot of that is a lot of times a long period. Now, the training we've had from drug court people, we've had training right here in Shawano County. We had it at the new building, the new social service building, and I think it was more than 1 day. And one of the things that has been told to us, and it's been told to us, high risk, high needs, and they have to have a high risk and high need, and they have to hold something over their head. The best practice is usually 1.5 years in prison, followed by 2 years of extended supervision. And that is imposed and stayed, which means if they fail, that's what's going to happen to them. Now, we just can't take an individual that is someone you'd put in jail for a year and say, because we're going to put you in drug court, we're going to impose and stay that kind of a sentence, because that wouldn't be right. That's not ethical, it's not right. So you've got to have people who truly are that far gone, that they're looking at those type of factors. So that's some of the issues that I think that pop up. When it comes to, I will say one thing that I see is a need that I have, because I think we all have needs. Tools that we need. I know when I worked up north on the drug court program, we looked in, when it was negotiated, we made sure that all the invested parties are able to have the tools they need, which included both the courts, the prosecution, the judges. So when we had that fund, we make sure that there was funding for the help that we need and so on. The commitment I had, and I said I think we can, with what we have, is be able to get 12 people through, 12 people at any one time. That's reasonable with our time period. I know we're looking at up to 20. That is going to be difficult for the court to do with time because we just don't have that time. Can't calendar that much time. I have actually doubled the amount of drug court time at the beginning of the year. But there is a solution. And I'm not asking for action on this, but I've said it before and I'll say it again. We have a part-time family court commissioner. That is part of the one of the people we have here. And court commissioners handle a number of different things. They handle some of the areas where there are, before you're getting divorced, they're meeting with and taking care of some family matters, some temporary hearings. They do these various things. Most counties have a full-time court commissioner, and that court commissioner has the same duties, but can handle things like small claims, uncontested divorces, restraining orders. With a full-time court commissioner, that would grant and give this court much more time where we could then handle much more people. We could handle those 20 people, I think, easily with a full-time court commissioner. That's one of my stumbling grounds right now. We're not at the maximum that I can handle right now. It looks like we're at somewhere 9. We still can get a few more with our calendar. But 20 would be not really practical at this point. And I want to explain why that is, because this takes a lot of time. Our court calendars are very congested, and when we have to schedule things, we're scheduling very, very, very far out. We don't want to people have to have divorces. We don't want to schedule those out 6 months, 8 months, 9 months out, because they have a right to use our court systems as well. So I think to make this program successful, and over the years in the grants that I've had to be responsible for as a prosecutor, we always put in our statements to our grant individuals what our stumbling blocks are or what our needs. So I will tell you the need that I have right now is a full-time court commissioner if we're going to expand this program. We need to have buy-in, and I think that everyone needs to buy in, and I think there's a responsibility at this point to look at that. And I've heard Ms. Egren, who gave a lot of facts and figures today, and said that, we've probably saved, it sounds like a few $100,000 in jail time. If those are actual savings, I think it justifies some of the money that we might need to spend to bring forth a full-time commissioner, so we can expand this program. If we can expand it to 20, then I'm hearing it's saving over $400,000. I think that would be a good use of the money. Like I said, I'm committed to this program. If I can have the commitment, I think, of the county in this, as well as the other parties. That's how I see this program. I will say that one of the things, when most of you hear what Becky has said of the people we've had and the failures we've had, the people who are terminated from a program, first of all, let me make it very clear, the terminations we have are not unusual. That's normal. People who have drug problems, it's a very, very difficult thing to solve, even with the best intentions. Obviously, the prognosis is not always as great as it could be. It's very important. One of the things this program can do, and hopefully as this program takes off more and more, we need to have community education, and this program can work to educate the community. I have found over the years, at least when I was doing it up north, sometimes that education doesn't come necessarily from a TV ad or a pamphlet, but it comes from the people who are in that program themselves. Sometimes you'll have individuals who they go through that program and they have an enlightenment. They realize that they went through this pain of going through this program and getting off these drugs. They become spokesmen for us, and they tell their other friends that this isn't the way to go. But that's my take on this at this point, and that's my comments. Mr.
Okay.
Chairman.
Thank you, Your Honor. We have one other interested party in the program, and that would be Mr. Parker. Would you like to speak, or someone from your office that is in on the drug program? Drug court, I should say. And like I said, we're not going to solve this today, but it was requested by a county board member to do this, so by rules, I have to do it. All right?
Good afternoon. First, I'm going to introduce you to Assistant District Attorney Laura Nelson. She has been taking care of the drug court since November of 2019. So I'm going to let her make comments because she's been the most involved with it for that period of time. And then we can make then I'll make some comments as well. Also, I'm going to be walking by as she's talking to just give you a couple of emails that I had very early in the program of concerns about the drug court itself and what we needed to do. So, so you'll have that. You don't have to read it now. It'll be borne out basically in our discussion.
So good afternoon. Like Greg said, I'm Assistant District Attorney Laura Nelson. I've been with the program since November of 2019 when I started as an Assistant District Attorney. Before that, I was a defense attorney. I took a lot of cases around Northeast Wisconsin, including Marinette, and I had several clients admitted to that drug court program. And I can tell you that for a district attorney to have veto power over admissions into the drug court program, Deshae Morrow, who is the district attorney up in Marinette County, she had final say before the participant was ultimately referred to the team. She interviewed the person, spoke at length with me at least, and she, before a referral went to the team, she had final say. So she actually made that final referral to the team before this, and made the screening referral. So it's not unusual the way that Shawano County handles this. And if Marinette County is one example, Shawano County is following suit. So I also want to talk a little bit about the referral process. Actually, I want to talk at great length about the referral process. Because there seems to be some disconnect in regard to what can and cannot happen. First of all, we cannot have anyone from DHS or from the treatment team going to speak with an unrepresented defendant while they are in custody or even out of custody if they have asked for an attorney to represent them. If that is the case, then the district attorney's office, whether you agree with it or not, will be sending a subpoena to that treatment provider or to Becky, for example, if she goes to screen that defendant or potential participant, we'll be sending a subpoena to her for her to testify for any communication that was revealed during that screening process, because those communications are not privileged. As you may be aware, there are certain communications that are privileged: doctor-patient privilege, lawyer-client communications are privileged, and pastor or priest and penitent communications are privileged, but not Becky's screening interview with a potential drug court participant. That is not privileged. So if she prior to a defendant or a participant having that attorney on board, if she goes to screen that person, that is not a privileged communication. And to the extent that that person makes an admission of having drugs in the vehicle or drugs on his person, or that she, any other fathomable admission, we are going to get that through the subpoena process. So I just want to make sure that everyone understands the referral process and what is not acceptable on the legal screening side of things. So not every law enforcement contact, first of all, or referral that comes to the district attorney's office turns into a prosecution. So it has to be in the system before it even becomes viable as a potential referral. So, for example, and I know we see Lieutenant Leiser here, anytime one of his deputies or an officer with the police department has a contact, that's not necessarily going to turn into a prosecution. We may no pros it for whatever reason. Maybe we don't think we have the burden of, or we can meet the burden of proof for whatever reason. And then, of course, not every prosecution on our side is going to go out to a defense attorney for an offer for drug court. And that might be one of several reasons. One, that person may not have a Shawano County residence, which we see a lot of. And I know Heather spoke briefly about that, and that's been an ongoing struggle for us. Highway 29 is a major corridor. We see a lot of people coming and going from Shawano County. We know that we have a lot of enjoyable lakes here. People come up here for a lot of recreational activities, and unfortunately, they bring drugs with them. Either the state troopers or Shawano County deputies or the police department are stopping a lot of people, and they're finding drugs. But not all of those people are Shawano County residents. And that's one of our struggles. We can charge them here because this is where the crime happened, but we don't necessarily get all of those people as eligible for drug court because they're not residents here of Shawano County. Second of all, they have to meet the legal qualifications, and that doesn't necessarily mean that everyone charged with a drug crime meets the minimum requirements. So, like we were saying, everyone charged with a possession of THC or even a first offense possession of cocaine, which is a misdemeanor, which may be shocking to some of you. We're not going to get those people who we can impose and stay a prison sentence with the required extended supervision. And that's what's required. We're going to need to have some stick to hang over their head in order to make this work, because we need a minimum of 2 years of probation in order to get them through this program. There was a very good question earlier about how long is this program? How long does it take to get them through? They need to be on probation for a minimum of 2 years, according to the policies and procedures that were defined by the drug court team. So they can't be on probation for simply 1 year, which is what we get for a possession of THC. Nor can we just impose and stay 9 months for a first offense THC. These are not kids who are caught smoking weed in the basement. That's not who we're targeting. And that's not by my definition. That was the drug court team. That was DHS with the high risk, high need. That's who they targeted. Okay. So it would be unethical for us to target that population. We also can't go to the other end of the spectrum and target the dealers, the traffickers, the manufacturers. We can't put those people in drug court. We can't give them their built-in buyer's base. We have those people here in Shawano County, but those people have a place to go, and that's called prison, okay? Those people are not going to go into our drug court. We're not going to put our participants, who we do want to help, we're not going to put those people at risk. All right, so we have the two ends of the spectrum. We need to find the middle ground. We still have to weed them out. We have, at the district attorney's office, we still have to see who else are eligible. We still have to weed through who's a resident of Shawano County. By looking at their record, we also cannot take in violent offenders, okay? So we have to look at their past convictions. We have to look at, we're not taking in OWIs. We're not in OWI court, okay? So if they are caught with OWI offenses or operating with a restricted controlled substance, we're not taking those people. We're not going to put the people of Shawano County, the citizens of Shawano County at risk with people who are going to go out on the road and drive while they're intoxicated or with restricted controlled substances in their system. Obviously, homicides, if they were convicted of homicide in the past, we're not taking those people. Any violent offender, and there's a definition of who a violent offender is. Kidnapping, if they were convicted of kidnapping. Criminal vehicular homicide, sex offenders. Anyone who committed a crime to benefit a gang. Now, these are all listed in the policies and procedures. So if they have that history in their conviction past, we are not going to take those people. And that's the screening process that the district attorney's office does, okay? So it's not as simple as taking a look at their, at whether they have a repeated meth history or a repeated heroin history and saying, well, yes, we need to send them over as a referral. The next thing that we take a look at then, assuming that the initial screening is done, and once they get a defense attorney on board, which can take a long time, and it's not just Shawano County that struggles with that. That's statewide, okay? In a recent case ruling that came out of the Court of Appeals, State versus Neely, the State Public Defender's Office issued a letter in there saying, we have a statewide problem appointing attorneys. It's not limited to Marathon County. So this is a statewide issue. It was a Marathon County case, by the way. So now we have a communication, we can communicate an offer saying, hey, the district attorney's office, we've screened it with the law enforcement. Law enforcement has taken a look at this, and law enforcement is okay with making an offer to the to the defense attorney if you want to extend a drug court offer. Now the defense attorney can talk to his or her client and say, do you want to participate in drug court? We can do a drug court offer. Now it's up to the defense attorney to say to his or her client, let's talk about drug court. Now you have one of three paths to go. And as a former defense attorney, I can tell you how this conversation is going to go. The defendant knows what jail time looks like, or prison time. Chances are they've been there. They've sat some time. They know what jail is all about. They know what a straight jail term looks like. They also know their chances of facing a straight jail time sentence looks like, based on whatever their offense is, okay? They also know what probation looks like. They know how hard probation is. They know how expensive probation is. They can weigh their options there. And if the defense attorney is doing their job, they're going to tell them exactly how hard treatment court is, okay? And I've had this conversation. I've told them, probation starts out really tough. They're in your face. They're in your life. You behave yourself, eventually, they're going to back off a little bit, okay? You might start off high risk, and then you're going to back off, and eventually, if you behave and you don't violate, then maybe you'll go to once a month, phone calls, house visits, things like that. They know this. They're used to the system. We know of defense attorneys who have said, don't even go down the road of treatment court. Don't go there. Ultimately, it has to be the participant, the defendant, who says, yes, I want to participate in this. And I can tell you for a fact, we have multiple offers out to defense attorneys right now that we're waiting to hear back from. It's the conversation with the defense attorney and the defendant that bring it back to us, and they say, yes, we'll take a drug court offer. That's when the defense attorney contacts DHS, Becky, and we proceed then with the screening. Because then the conversation is privileged. We go ahead and we set the plea and sentencing date. There's one right now set for April. Apparently, according to my conversation with Becky, it's kind of iffy whether the drug court even wants them. But we'll have more discussions. We'll get her in. In any event, it's not a simple, there's a defendant charged with drugs, let's get that person screened in, and that person is accepted. It's a multi-layer process that everyone has to appreciate and be patient with, because the legal system isn't like CSI or Ally McBeal or LA Law. It doesn't happen that way. So, with that in mind, does anyone have any questions?
I would like to avoid the questions. We've been at this for an hour and a half, and we're not
That's
going to,
okay.
we're not going to solve the problem here today. If you would like to take a few minutes, Greg, and say your piece.
I'll be brief. One of the things that I heard here today, and this subject has only briefly been broached in the beginning of the program, and that was whether or not we could take people from Menominee County. The problem with that I understand is because of the jurisdictional aspect. It's a sovereign nation. So that somehow would have to be worked out. And yes, as Ms. Haflinger had mentioned, we have a lot of cases that come from not only Menominee County, but other counties as well. But if Menominee County was able to be included, that would give the base, that would give our base more possible referrals. But it's the jurisdictional aspect, the fact that I said they're a sovereign nation, and if that's the case, it may not even be able to be done. But we shouldn't do a discussion about it. We should do a discussion about it. And perhaps that can be taken up soon. We've never had that discussion. It was just determined in the beginning it would be Shawano County residents, and that's it. Secondly, as Laura was saying, there are multiple people out there that have been asked about drug court, but here, we all sit here with our masks on. We don't escape COVID even in the criminal justice system. And I'm sure you're aware of that. We are now 354, as of the beginning of March, I believe it is, will be 354 if my victim witness person's calculations are correct. 354 adjourned trials, meaning jury trials that have been scheduled or are going to be scheduled, and at this point in time, we can't even have a trial yet. There's only tentative approval as far as I know. But the defendants have figured out, though, if they're out on bond, one of the things they can do is to delay their case, is to ask their lawyer, I want a jury trial. And it gets kicked way out. And we are having trials that are being scheduled. For example, the other day I was in court in October, 8 deep. 8 deep. So this isn't the simple solution. But as far as getting more referrals in, we have to light the fire under hopefully some of the defense attorneys. This is another issue. I told my prosecutors, if you have somebody for drug court, let the defense attorney know. 2 of our prosecutors have left. One retired in January, early January. The other one left in the area, or in around about 3rd week of December. We've replaced that one person. We still have another to go. So now what I hadn't had the opportunity before is now I'm able to see the one retired prosecutor's cases and start reviewing them because I have to reassign them to somebody else. And in that vein, I'm able to see if we have people that should have been or will be also referred for drug court. So those are my comments. I said I'd keep it short. Thank you.
Okay. Basically, I sat down and I talked with all the interested parties, and them are the answers that I did get from them. The district attorney feels that there's not enough people that qualify to fill what would be there to get the numbers up, so we would meet the state grant. And the judge feels that they just do not have the time, and that would require us to step forward and provide more funding as a board. And Health and Human Services would like to see the program stay and keep operating. I would too, because I think if you can get anybody out of that cycle, but it's not as easy as we think sitting here and your first opinion that, well, if somebody comes in, we can run them in there because there's so many restrictions and requirements that have to be done. So all I was going to suggest with this is we certainly can't solve it here today, but we can start looking into it a little more. And I believe the two committees just to start it would be public safety, because that's who the district attorney and the judge, I believe, are under, and Department of Health and Human Services, and that may require some joint meetings and some discussions. Perhaps we could get Menominee County. I was not aware that they weren't eligible. I didn't learn that in the past discussions. And I'll put Jimmy on that to start looking into how and if we could merge between the two counties. Well, he is taking notes. And start looking into this, if we can join with them to possibly get more funding and more people to where the state wouldn't say you're not trying hard enough. But it's not a easy solution at all. And if anybody has any ideas, bring them forward. Send me emails, suggestions, anything you can come up with, because I don't have an answer for it either. Not at all. And we have to go to work on it though, or losing the funding, to me, I think it's good money spent. If you get anybody out of that cycle, they're not going round and round and round again. Right back into jail, right back into court, out on probation, because we're paying all them people for processing them in that service. And that's all very expensive items. So we will move on. Then we have quite a list of items to get through, and I promise you, I will never let the chairman's comments take us an hour and a half to get through again. Item number, no, I would like to move on. We spent an hour and a half on it already, and otherwise we'd be spending another hour if we keep taking questions and comments and answers. Let's move on to item number 7, readings of petitions, memorials. Pam?
I don't have any.
We have none, okay. Item number 8, ordinance number 1-21.
To modify, am I on?
Should be on.
To modify ordinance number 8-19 concerning the use of all-terrain vehicles and utility terrain vehicles. Now therefore be it ordained by the Shawano County Board of Supervisors in session this 24th day of February 2021 that the following ordinance for ATVs and UTV routes on the county highway trunk system be adopted, submitted by the Highway and Parks Committee.
Is there a motion to approve? Motion by Kevin, seconded by Jean. Any questions or comments? I see John is up already.
Question, first of all, and this may be unfair to spring this on him this soon, but there are several references to state statutes in this ordinance, do any of those state statutes require a driver's license or liability insurance for these vehicles? Tom, are you aware of that?
I know from past experience, John, from when we started this, and I was on the highway committee, most of them statutes that they're going to refer to are, I believe, traffic ones of what would happen in that part. The other ones, most of what it was based on from day one was the DNR when we put that through.
So there's probably not any requirement for a driver's license or liability insurance included in those statutes.
Not that I'm aware of. If you could, Mike, Tom, it's on, I think, yep.
I'm sorry. I would just reiterate what the chairman indicated, that there's no requirement of licensing or liability insurance, and it would just be complying with Department of Natural Resource, ATV and UTV operation rules.
I know they can't modify them, John. Anything that's not the vehicle itself, I remember from the last time around, that has to be manufactured to a certain set of specifications. And if they add like a light bar up on the top, they can have that, but legally they can't have it on when they're on the road, because it has to be what it was originally manufactured as
So
approved.
if one of these vehicles is involved, causes an accident, nobody's liable.
I would disagree with that. The operator would be liable just under common duties of ordinary care and negligence law. They would still have a liability, just like you do when you operate a vehicle on the roadway. The question would be is if they don't have insurance, would they be collectible? That would be the real question.
And a 12-year-old being held liable, that's
There is some
difficult.
parental liability, but it's limited in terms of dollar amount of what the parent can be held liable. I believe it's $2,500. So there could be liability that a child would cause that the parent could be liable for a portion of it, but wouldn't be anything close to what the actual liability would be, if that makes sense to you.
Okay, any other questions, John?
I have a proposal after the discussion continues.
Okay. Randy Young, and I got Grant coming up too for questions.
The issue that I have is that if my turn signal doesn't work or I don't have my safety belt on, I could get a ticket or fine for that, and some of these vehicles don't even have those. They don't have turn signals, they don't have safety belts. My ATV doesn't have either of those. I just, from day one, I've said this, I think it's a bad idea to mix these vehicles on county roads with regular vehicles. If the towns want to do it on theirs, I'm fine with it. It's the county roads that I have issues with. I just see it sooner or later, someone's getting hurt.
I believe, and now this is only speculation on my part, there has not appeared to be, what's that? Oh. I believe there has not been many incidents, has there, George?
No, unbelievably, it's been a lot better than we expected.
Than what was thought from the beginning, yeah. Okay. Would you like to speak toward it, Grant?
No, I guess I'm up here to answer any questions. Basically,
Okay.
this ordinance, the main thing that alters here is we piecemealed. The original ordinance had so many different segments, and if you recall, we started getting so many requests in different segments that I think the traveling public, people that utilize the trail system or the county roads, and I think even enforcement, it was difficult because there were so many segments where you'd go down a stretch, it was open, close, open, close. So I think this is the intent behind this ordinance that's brought in front of you from the highway committee was to open it up and clarify that it would all be open. Correct.
Okay. Mark Boland.
Thank you. I would caution against making any rules more stringent than what state statute already is, because it then takes away the enforcement ability for the DNR the state patrol and leaves everything on the sheriff's department. As soon as you change, they will not enforce our ordinance.
Okay. Any other questions or comments? Back to you, John.
Okay, if there are no other questions, I'm going to propose an amendment. No, under number 5, in addition to number 5, no person may operate an ATV or UTV on any part of Shawano County highways without a valid driver license and proof of liability insurance. If there's a second, we can discuss that.
Do you have that written down?
Pardon?
Do you have that wrote down, John?
I do
for
not,
Ken?
well, scribble down, yes.
Just so I can get it up.
Sure. Under number 5 there. I hope you can read my scribbling, but
You are in section 3,
5.
John?
5.
I think section 3, number 5, I think.
Oh, I'm sorry.
Section 3, item number 5.
Right.
Okay,
Tom, could I provide one?
sure, go ahead.
Just so everybody's on the same page, and I think John understands this, but I had a discussion with George earlier today. No person under 12 years of age shall operate an ATV, UTV under any circumstances. 12 to 16, they can if they're accompanied by an adult. And I looked into that explanation of accompanied by, which would mean 12 to 16 with their operator license, they could operate the ATV of their own accompanied with another adult on an ATV. So it's not just driving a UTV together, it is operating their own ATV with the license accompanied by an adult, just for clarification for everybody.
If, Mr. Chairman, if I may comment while she's doing that, I'll save a little time. We have on our county highways loaded log trucks pulling loaded trailers of logs. We have full-length semis on our county highways that stop and back into driveways, taking up the entire pavement and both shoulders when they back in. We have farm equipment that can be as wide as 16 feet. We have horses and buggies that travel, 12, 14 miles per hour. These vehicles are fully capable of passing that 16-foot farm implement or that horse and buggy. And these kids are going into 6th grade. They're not given any driver's training, driver's instructions, anything like that. I just don't think it's safe for our 12-year-olds. I think they should have a valid driver's license and proof of insurance as we need for our motor vehicles.
Okay.
Thank you.
Well, we have a motion for an amendment. Is there a second? Before we continue anymore. Second by Sandy Stanky. Okay, then we will go back to discussion on the amendment, please. Ken Capelli. Not on the amendment. Not on the amendment. Deb, the amendment?
Yes. John, you said valid driver's license, but doesn't the statute say 12? I mean, you just mentioned kids in 6th grade. The 12-year-old can't get a driver's license.
Well, exactly, and that's my point. They should have to have one. It should be modified so that they have to have a driver's license to operate on the highway, just like anybody else.
Okay. Joel Miller, on the amendment.
I do not support the amendment. You do not need question to drive. Respectfully, John, respectfully. The farm equipment, do you need driver's license and insured to drive that on a highway? So I do not support the amendment. I do support the original. Thank you.
Mark Boland.
He just said what I was going to.
Okay. Is there any other comments on the amendment? Okay. Seeing none, if you are in favor of the amendment, you would vote yes. If not, you would vote no. Arlen? Okay. Failed on the majority vote. According to the system we have, it doesn't give me the number up here anymore. Yes, it does. We have 8 yes, 19 no, with no one absent. So the amendment has failed. Now we are back to then any discussion on the ordinance itself. Richard Perfecki.
Just to clarify, the farm vehicles on the road, that's a vehicle of husbandry, that's state law. They can't stop them from going on the road, you don't need no license.
Okay. Ken Capelli.
I just would like to comment on Section 4, the speed limits. We are putting another vehicle type on our roads now. These vehicles are capable of driving the same speed as a normal vehicle. They are not a slow-moving vehicle. So I would like to follow what Mark had said about too many restrictions as far as enforcement. If we got a vehicle on our roads, then that vehicle has to abide by the posted speed limits. Not that you got a special speed limit for this vehicle, a special speed limit for that vehicle. All vehicles, once they're on the road, should be treated the same way, same speed limit.
This 35 miles an hour, I know comes from Ken, that's what the state has passed. Is the 35, no more than 35.
But we cannot go on state roads with these vehicles. This is a county issue.
Yeah, but then we would
This is
be,
county roads only and town roads.
but then we would be opening it up from what the state statutes are. We'd be changing what it is in Shawano County for the rest of the state if we up the speed limit.
There is a statute that says
Yes.
specific to
That-
these
that's-
vehicles?
Yep, not a statute, I believe it's the DNR passed it. I remember that from the first go-around, that the DNR established that, because that's what we used for a model when this all started, was what the DNR had as a guide.
I just think it would be a lot more safer without that 35-mile-an-hour speed limit. And I do have one, so I do know what those vehicles are like on the road. They are faster than horse and buggy.
Yeah, well, I know they're much faster than 35, Ken, yeah.
Pardon?
They're much faster than 35, I'll agree, but
I think the original intent behind this was maybe more towards ATVs, because an ATV with a locked rear differential is a lot different than a UTV with a unlocked differential that can actually turn on asphalt or a paved surface. So maybe in the future that there is some modification, but that was the rule put forth by the DNR at the time when this ordinance was passed, and I'm not aware of it changing any.
okay.
Okay, if at some time in the future, if we could look at this again then, or find out from the DNR, because it's unbelievable how many of these vehicles we have right now in Shawano County.
Mm-hmm. And there's more coming.
Well, if they can get them, they can't get them
Yeah.
right now. But I would be in favor of going to the speed limit, the posted speed limit, no matter where you are, it's the posted speed limit
Okay,
for that vehicle.
all right.
We got motorcycles, we got everything else, trucks, tractors, horses up and down the road,
Yeah,
and now we're singling out this one vehicle.
well, not to buck you, Ken, but I don't know too many horses that can go 55. Joe Miller.
Very briefly, thank you, Mr. Chair. My support of this is due in the township of Bartlemy. In order to get from the north side of County Highway A to the south side of County Highway A, you have to go down portions of it on town roads. So that is my support of this. There are portions of county roads that must be used to get from one town road to another. Thank you.
Okay. Arlen Tober.
Yes, I'd like to go back to the speed limit. And the way Grant was telling us at our meeting, that practically half of the county roads are already available for the places, so we're talking the second half. And so there's been quite a bit of experience now, and I'd like to ask an officer in that, do they have much problem at all with the speeders going 70 miles an hour or 60, I mean, with those things?
We have very few speed complaints on ATVs and UTVs. They're very isolated. It's usually, you might have a couple of kids in one township, and after we deal with it, we've been lucky and haven't had repeat problems.
Okay. Kevin Conrad.
I was just going to comment if the state makes any changes in their, or the DNR makes any changes, we'll look at it through the highway committee and bring it back to the board if we feel they need some changes.
Okay. Gene Hoppy.
Yes, you know, the towns have their rules that they put up forth, and I think 35 miles an hour is agreed by the towns. And I don't think we should buck them. I think that everything is going along good. I think, I like the idea that we're gonna use some of the county trunks, but I think the speed limit should stay at 35.
When, to refresh anybody's memory, or those of you that may not have been on the board when this started, when this first came about, the highway committee, we used the DNR's line, like, of what should be for everything, and they were the ones that set the 35-mile-an-hour limit. And then at first, every town was just taking something they found off the internet, and they were making up their ordinance. And that got to be such a heyday of this one's a little different, that one's a little different, that we were beginning to wonder how the sheriff's department would even be able to enforce it. So Steve went to Steve Geets, as a member of the highway committee, went to the Towns Association, and they all kind of got on board. So we had one uniform one at 35. That way, when the deputies are out there, excuse me, not 35, 35 or the posted limit if it's less than 35. So the deputies had a much clearer understanding of it's not 35 here, 23 over there. It's all the same throughout the county, which would make it easier for them to enforce. Otherwise, for a while, we didn't know how to even really pass the information along to the sheriff's department, so the deputy would have some idea of what town he's in if he was pulling them over, and what the rules actually were. So, John Ainsworth.
Just a brief comment, and I don't think it'll change the outcome, but if an adult loses his license due to DUI convictions, he can still take the ATV down to the corner bar. He doesn't need a driver's license.
That is correct, George?
Yeah, you do not need a driver's license. If you lose your license for driving a motor vehicle, you can still operate an ATV. And if you are convicted of drunk driving on an ATV, you do not lose your driver's license. It's a recreational vehicle is totally separate than a motor vehicle. The state has been looking at it for years now of combining those, where if you do get a OWI
Okay. All right, Mark Boland.
Real quick, Grant, thanks for writing a clean ordinance. This is clear, concise, and it's enforceable. It follows state statute, and we should move forward and push it through.
Okay. I don't see any other requests for questions or comments. So if you are in favor of the ordinance as written, you would vote yes. If not, you would vote no. Passed by a majority vote, 23 yes, 4 no, and no abstentions. Moving on. Item number 9, ordinance number 2-21.
Approve proposed amendments to the Shawano County Livestock Facilities Licensing Ordinance Number 1-18. Now therefore be it ordained by the Shawano County Board of Supervisors in session this 24th day of February 2021 that the Shawano County Livestock Facilities Licensing Ordinance be amended as proposed and be effective upon passage and publication, with direction that the ordinance be forwarded to the Wisconsin Department of Agriculture, Trade, and Consumer Protection, submitted by the Land Conservation Committee.
Is there a motion to approve? Motion by Richard Furfecki, seconded by Arlen Tober. Scott, would you like to speak on it quick? Could you reach over, Terry? I believe Joe left, and there you go. Nope, if you can check him out. There we go, thank you. Go ahead.
Thank you, Mr. Chairman. Good afternoon, everyone. So the amendments before you, just guys give you a little short history. We revised this ordinance back in 2017, 2018, and made it a standalone ordinance. Otherwise, these provisions were in our previous livestock waste ordinance that, with the inclusion of these in 2006. The amendments before you today were essentially started by a farm that requested or has a project before them that cannot meet the thresholds of the ordinance on, I think of it's section 17, page. I don't have the page in your county board packet, but it's section 17, item number 8. And these thresholds were, I guess, back in 2017-18, in communications with DATCAP staff, Department of Agriculture, Trade and Consumer Protection staff, through their recommendations and our staff's review, we felt that these provisions would be appropriate for basically, current farming activities, to accommodate those with larger equipment, allow space between lot lines and road right-of-ways, and also give us considerations for the environment, public safety, and neighbors. And even though these provisions are not required in by state statute, we felt they were appropriate back 3.5, 4 years ago. You try to address as many situations as you can with an ordinance, but inevitably you don't over time. You find situations that just don't fit. And I guess the fact that it came to light in the last few months, I took a real, hard second look at it and felt that these, I don't want to call them arbitrary, but unnecessary. I feel they're unnecessary. These thresholds were put in place where we had those ideas in their head of, protecting public safety and the environment and neighbors, where that's kind of when the Board of Adjustment reviews variance requests, that's some of the criteria that they use to justify or deny a variance. So if there's a situation out there that can meet the criteria for a variance and needs to be lower than 25 or 50 feet to a lot line or a right-of-way, I don't think as a department and as a county, we should probably be putting some of these thresholds in place when the governing body of, the Board of Adjustment is there to kind of make that call and review the criteria as appropriate. So I guess that's to make a longer story than it needed to be, but I wanted to at least give you a background and kind of how we got to today. I'll take questions.
If there's any questions? Aaron Damrow.
I guess I'm concerned, I expressed my concerns when I spoke today, about removing any type of minimum threshold for any type of livestock facility from neighboring adjoining properties. I mean, right now, the public policy is that you can't have a livestock facility within 25 feet, no matter what. You can't grant a variance for less than 25 feet. And do we want neighboring properties to be, I mean, having a farm right next to your property is, I mean, it can get stinky. And I mean, you got public health issues with manure facilities. You got 50 feet with waste storage structures is the absolute minimum. So that's what this ordinance does right now is we set a minimum for agricultural facilities from the neighboring properties. You're protecting the neighbors of the farms by having this ordinance. And by removing these minimums, you're putting it in the hands of a board of people to decide whether or not this farmer should be able to put a feedlot within 25 feet of the property line, and that is concerning to me. I think that with the, I guess I don't know. When we spoke earlier, we talked about the notice to the neighbors, and that, I mean, if there were stronger protections for neighboring properties to be a part of the process, I think that I might feel more comfortable. But right now, it is a board of people that can say that, yeah, these are extenuating circumstances. I think that you should be able to put your feedlot or your manure pit even closer than what the variance or what the limits are. And I mean, I don't see a reason for having any type of livestock facility within 25 feet of a adjoining property, or a manure storage pit within 50 feet of an adjoining property. And if it can't fit there, it has to go somewhere else. And I think that as a matter of public policy, it's good to have limits to protect the neighbors of these farms. So that's my 2 cents.
Well, I get your concerns. Within the ordinance itself, it does address some of the concerns you mentioned about, distance to the property line, distance to neighboring houses. There's an odor scoring provision or criteria within the ordinance that the farm has to meet. So it's not like this is the only, criteria they have to meet before we issue a license. So if they propose a barn and they want it to be 25 feet away, they still have to meet odor scoring criteria for that farmstead to neighboring properties, residences. So there is that type of provisions to address the neighbor. And when you get at, I agree it's nice to have these minimums, but when there's sites that can meet the other criteria within the standard to approve a farm expansion for a license, I think that this is kind of an overreach, an arbitrary overreach by putting these in there when they can meet the other criteria that we'd approve it for, when it's not part of a state code.
This is not only for neighboring properties, though. This is to the right of, the road right-of-way.
Yep.
So this is saying that we want these agricultural facilities off of our roads. I mean, they're high traffic, you got machinery coming in and out, you got, I mean, there's multiple public safety reasons for having minimums off of the right-of-way too, so that's.
Yep, and that's exactly what the Board of Adjustment, they have 4 criteria they're supposed to be looking at. Public's, the public interest is one. As far as, view corridors or, view triangles at intersections, all that stuff is looked at before you'd actually, approve or have Board of Adjustment approve a variance like a situation that may compromise public safety.
What are the criteria that the Board of Adjustment have to look at in order to grant a variance?
They got 4 criteria. The first is, and this, I guess, a variance application is submitted to, in concert with the Plan Development Department, my department's, or Land Conservation Department staff, assist the applicant with the application to address these criteria. And then once that application is in hand, it states in here that staff is supposed to review the application against those standards. Okay, so that's some of the first steps. And then once it gets to the Board of Adjustment's hands, so the criteria is, 1, is there an unnecessary hardship? 2,
Where are you looking?
I'm looking in the zoning code.
Okay. We don't
Yeah, you don't have that, but yeah, it's, so in the ordinance in front of you, it references in item number 7 up above number 8 where the amendments are. And item 7 references the zoning code that the variance process is pointed out of how we go about it. So unnecessary hardships, 1, unique property limitations, there's 2, and protection of the public interest is 3. So where does it say here? Well, I'm sorry, it's subsection, it's just subsection 4, but it's the 3 criteria they're supposed to meet.
So, and there's nothing specific in there about neighboring properties that they are considering.
I mean, I would interpret the public, when I read here for public interest, it says, protection of public interest. Granting of a variance must neither harm the public interest nor undermine the purposes of the ordinance, which the purposes of the ordinance are to protect the public health and safety of the people of Shawano County. So they need to address that. In granting the variance, the board may attach special conditions to ensure the public welfare has not been damaged. Such conditions must relate reasonably to the purpose and intent of the ordinance. Also, any variance granted should include only the minimum relief necessary to allow reasonable use of the property. So.
Thank you. I'm opposed to the motion. Thanks.
Okay.
That's fine.
Kathy Lubke.
I look at this completely different. If you read it, it says you may grant a variance from the setback requirements. If you look prior to this part, there's setbacks requirements in the ordinance. And this is all under the appeals and variance procedures just listed. Personally, I don't even think we needed to do anything with it, but it just basically just says you may grant a variance. That's all it is just putting it out there. I don't think we should read into it as much as we have been today. So that's it. Thank you.
Richard Perfecti.
Yeah, besides everything else, the state's got the right to farm laws, so there's a whole statute of the state that have to be changed, and it's up to the counties to decide what kind of setbacks they want to use.
Okay. Is there any other questions or comments? Seeing none, then if you are in favor of ordinance number 2-21, you would vote yes. If not, you would vote no. Gene? Marvin and Dennis. Need a hand up here. Yours not working either, Gene? Nope, Gene's in. Been here so long, computers are falling asleep. Okay, we have 21 yes and 8 no, and, 3 no and 1 abstain with 2 absent. So the resolution has passed, or the ordinance has passed. Item number 10, resolution number 4-21.
To approve patrolman foreman position at the Highway Department. Now therefore be it resolved by the Shawano County Board of Supervisors in session this 24th day of February 2021, that it does hereby approve the reclassification of the patrolman position to the patrolman foreman position within the Highway Department and placed at grade J of the wage scale. Be it further resolved that the Highway and Parks Committee and the Executive Committee shall approve the job description for the patrolman foreman position and update the Highway Department organizational chart accordingly. Submitted by the Executive Committee and the Highway Parks Committee.
Is there a motion to approve? Motion by Kevin Conrad, seconded by Stephen Geets. Would you wish to comment on it, Kevin?
This is a fully funded position by the state. Right now, say if a crew is out working, putting up snow fence or something like that, we don't really have a foreman on the job. So now at least we'll have a foreman there that people need to answer to. It's not adding a new position, it's just reclassifying, as it says.
And it's actually going to add more funding for the
More
Highway
funding from
Department
the
from the
state,
state. For when they're working on state roads.
Right. Because now when they're out in the field, say if they're doing some work on, say, 29, or putting up snow fence or doing other things like that, you might have 6 or 7 guys out there doing work and there isn't one that's a designated foreman, so it could run into problems. We're just trying to address it.
Okay. Dennis Knack.
From when I was on the Highway Committee, don't we have state superintendent already? Somebody funded by the state?
Grant?
Yeah, overall, we have 72 employees within the highway department. We have two daily superintendents. Half of their wage is paid for, each position, half of their wage is paid for by the Department of Transportation. We have multiple jobs going at one, throughout in any given day. So our superintendents will get out. They're not eligible or able to stay on the project site for the entire day. So what typically been happening is we have a good crew of guys, the patrolmen that work on the state system. They'll all try and step up and say, all right, let's do this, but there might be 3 or 4 of them trying to take that lead role, and we just want one person to designate the on-site foreman that can coordinate back to the patrol superintendent who might be at various different projects overseeing on a daily basis.
So these two are half funded.
Correct.
They aren't fully
No,
funded.
I'm sorry. No, the two supervisor positions are each 50% funded. This position's 100% funded by DOT. Their patrolman positions we have 16 designated positions that work on state system year round. And we'd be taking one of these 16 positions. We had some retirements and some shakeups there. We've been thinking about this for years, and the time was right now. We had the position that was open. So we did not add a position, we just refilled. We took one of the senior persons that applied for the position and designated them as the foreman.
Okay.
All right. Yeah, I thought it was a duplicate of.
Nope.
Okay, any other questions or comments? Okay, seeing none, then if you are in favor of resolution number 4-21, you would vote yes. If not, you would vote no. 25 yes, 0 no, with 2 absent. The resolution is passed. Item number 11, resolution number 5-21.
Approving county farm crop lease agreement. Now therefore be it resolved by the Shawano County Board of Supervisors in session this 24th day of February 2021 that it approves the attached county farm lease agreement submitted by the Public Property Committee.
Motion to approve by Randy Young, seconded by Gene Hoppy. Is there any questions or comments? Jerry, do you wish to comment on it?
Well, I can just say that this is, instead of a multiple year lease, now it's going to be a 1-year lease at a time until we decide really what's going to happen with the solar farm. So it's a typical lease, it's just that it's a 1-year lease.
Marvin Klosterman.
Yes, I'm just a little bit concerned about why the public properties just assumed that they could do this without contacting all of the committees that were involved. In the rules under extension, agriculture and extension, one of the rules is to look after and supervise management of the former county farm acreage. To my knowledge, nobody from the public properties came to our extension committee to talk about this is a possibility, or this is what we'd like to do, or this type of thing. I think that they sometimes are utilizing powers that they don't have.
Okay. Jerry?
To my knowledge, Steve Dreyer had talked with individuals in ag and extension, and they were in agreement that property should take over or be in charge as long as the solar farm system is being looked at.
That was my understanding also, Marvin, that it was bought up at public property, and they, or not public property, excuse me, Ag and Extension, and they turned the responsibilities over to public property.
I didn't miss any meetings, and I don't recall that ever even being asked at a committee meeting.
Okay. Arlen Tober.
Yeah, I'll agree with Marvin on that. Steve Cummin did talk to us that public property was going ahead with it, but it says in there that we do have control of the leasing or renting of the property, and nobody come afterwards to do anything with the lease. Talk to us about it. They just, the property committee didn't come until it was almost a done deal.
Okay.
So
I questioned that even at our public property meeting, and that's what we were informed, is that you guys had gave them the blessing. So, well, with that in light,
But I'm willing to go ahead with it, but I think it should have been maybe handled a little. They should have come and talked to us, or somebody should have, about what yous were leasing with it. I mean, we knew about the solar, and that's about it, and then yous were gonna look into it.
okay.
That's the last we heard of it until it was done, so.
Some of the reason then that this may not have come back to Ag and Extension was originally when the solar farm was gonna start, the individual had a lease. And if the solar farm was gonna happen, we had to send him a notice far enough ahead that we may be terminating the lease. And since the solar farm and everything got ironed out, and we still can rent the land out, that's why we went through and did this, because we thought it would be fair and right to give him his lease back. And that's what we had thought that was agreed to by, basically by yous, because it's the same rates, the payment rates and everything are all still the same. But we'll have to, definitely have to iron that out in the future. Ms. Marvin.
And I agree with what you're saying, except I think it would have been just proper if they would have, if the public properties would say, hey, this is what we would like to do.
Yeah.
At least they made to our committee that we would know. Because approved the last lease that Mr. Rosno agreed to.
Correct. So, all right, no, we will, that'll definitely be brought up. Rick Geezy.
We did, in a motion, have Steve as our contact person, dealing with our renter, smoothing everything out and everything. So that wasn't a motion that he was gonna be the, just like he did for you, be the contact person dealing with our renter. So we basically did do a verbal agreement, and there's actually an motion that we did, yeah, we didn't see the terms of the lease, but you went ahead and did what we wanted it to, so. No, you went ahead and did what we approved at the committee meeting.
The committee did make a motion, in your recollection, and pass it.
Yeah.
To let Steve,
Yeah, we didn't see the gist of the contract, but we did give him the authority to go ahead and work on it.
okay. All right. Terry Tipton,
It seems as though the rate in the
a little
lease-
closer to the mic, Terry.
It looks as though the rate in the lease is probably carried over from previous.
It was from the last, I brought it up that I thought it should be bid out. And what I was told is the original term that the gentleman that has it right now would have still been continuing on. So that's why they thought we should have some type of lease, so it's clear between the county and him, now that the solar farm issue is kind of ironed out with a contract, that there's a clear understanding of what would be expected of him and what we would do. And that's why the rates and everything pretty much stayed the same. It was just a little language that Tony thought to change in there to clean up the whole thing, because otherwise you can't just go back and say, well, now, here it is, and what's gonna happen if the solar farm starts in the middle of the summer, if they want to? Who's gonna compensate who for seed and crops and that things, and that's why this was addressed and a contract drawn up again.
My suggestion would be that we reevaluate the rate in the future, though, if this.
In the future, it
goes
would.
on. So,
The intent that I got of it, Terry, was this was being done strictly to move it to a year-by-year basis
yes,
with the same individual who would have still had, if none of the solar farm, anything would have happened, he would have still had that same contract.
correct. It's, for current rent rates, it's probably at a discount, so.
Okay.
Just for the future, it needs to improve.
Okay, well, we'll have to make sure it goes back then too. We will next time to Ag and Extension. So that doesn't get missed or misunderstood. So with that, if you are in favor of the lease, you would vote yes. If not, you would vote no. Deb? 25 yes, 0 no, so the resolution has passed. Item number 12, resolution number 6-21.
A resolution in support of increased county child support funding. Now therefore be it resolved that the Shawano County Board of Supervisors respectfully requests that state funding for county child support agencies be increased by $4 million GPR in each fiscal year of the 2021 through 2023 Wisconsin state budget, which will generate approximately $7.7 million in additional federal funding each year. This investment will ensure that Wisconsin counties can continue to effectively provide economic support to our children. It is further resolved that a copy of this resolution be forwarded by the county clerk to the governor of the state of Wisconsin, state senators, and state representatives representing Shawano County, the secretary of the Wisconsin Department of Administration, and the Wisconsin Counties Association for consideration, submitted by the executive committee.
Is there a motion to approve? Motion by Kathy Lubke, seconded by Aaron Damro. I do have Courtney here if anybody would have any questions or comments, but this is basically one of these generic resolutions that was sent to us from another county. And I had said that I would forward them always to the appropriate committees to see if they thought we should have them or not. And since this was admin, I guess I had to forward it to myself, and we run it through. And it's basically just trying to get the state to support more funding for child support in their collection efforts. Because dollar for dollar, they're generating pretty good revenue right now compared to what's being done. So if there's any questions or comments? Okay, seeing none, then if you are in favor of Resolution 6-21, you would vote yes. If not, you would vote no. "24 yes, 0 no, with 3 absent. We lost Mike Wiesner also. Yep, okay. Moving on. Item number 13, resolution number 7-21. Pam?
To accept a highway safety grant awarded by the Wisconsin DOT. Now therefore be it resolved by the Shawano County Board of Supervisors in session this 24th day of February 2021 that it does hereby approve the acceptance of the Wisconsin Department of Transportation grant for Shawano County in the amount of $22,500 for seatbelt and $12,500 for OWI special enforcement operations to be used during 2021 and consistent with other terms herein above. Be it further resolved that the Public Safety Committee shall oversee the proper receipt and expenditure of these grant funds. Submitted by the Public Safety Committee.
We have a motion to approve. Motion by Bill Swatala, seconded by Jerry Erdman. Is there any questions or comments? Do you like to comment on it, Mark? Okay. Is there any questions or comments? It's just an annual one where the state provides funding for deputies to enforce specific laws that they have, so. Okay, if there's no questions or comments, then if you are in favor of resolution number 7-21, you would vote yes. If not, you would vote no. Richard, yours didn't take. Okay, 24 yes, 0 no, with 3 absent, so the resolution is passed. Moving on, item number 14, resolution number 8-21. Pam?
Approve amendments to the Town of Navarino's official zoning map. Now therefore be it resolved by the Shawano County Board of Supervisors in session this 24th day of February 2021 that it approves the official zoning map amendments for the Town of Navarino as follows. Town Map Amendment 1-21, adopting the Town of Navarino's official zoning map amendments. The county will consider the following 2 parcels to be amended from the recreation and public open space to hamlet. Submitted by the Planning, Development, and Zoning Committee.
Is there a motion to approve? Motion by Kevin Conrad, seconded by Gene Hoppy. Steve, would you like to comment on it, or?
Why don't you turn over to Kevin? He was on the committee also, so that's his town.
Okay. Okay, Kevin.
It's just, the town is selling 2 little lots, a 50 by 50 and a 50 by 60, that is currently adjoining the old school property. It's gonna square up the old school property, and the reason it had to come before this, because the ballpark is zoned different than the school.
Okay.
So we had to make this amendment.
All right. Is there any questions or comments? Okay, seeing none, then if you are in favor of resolution number 8-21, you would vote yes. If not, you would vote no. 24 yes, 0 no, 3 absent, so the resolution has passed. Item number 15, resolution number 9-21 to approve a zone change, whoops, Pam?
approve a zone change for Mike Hoffman. Now therefore be it resolved by the Shawano County Board of Supervisors in session this 24th day of February, 2021, that it approves the zone change as follows. Z121, Mike Hoffman, Hoffman Land Surveying LLC, agent for Joseph Greiger. Owner, requests zone change on a 2-acre parcel from Farmland and Forest Preservation Zoning District to Agricultural Residential Zoning District pursuant to the Shawano County Zoning Ordinance Number 7-14, Section X2021, Section X3022, for the purpose of constructing a single-family dwelling. Property is located and described as part of the Southeast Quarter, Section 25, T26N, Range 12E, in the town of Fairbanks. Currently vacant land, submitted by the Planning Development and Zoning Committee.
Is there a motion to approve? Motion by Aaron Damro, seconded by Steve Geetz. Do you wish to comment on it, Steve?
Yes, this couple wants to build a house, and they had to get the zone change from farmland preservation over to OAR. And Town of Fairbanks recommended approval, so.
Okay. Is there any questions or comments? Seeing none, then I guess if you are in favor of resolution number 9-21, you would vote yes. If not, you would vote no. "24 yes, 0 no, 3 absent. So the resolution is passed. Item number 16, resolution number 10-21.
To approve amount not to exceed $25,000 from contingency fund for housing study. Now therefore be it resolved by the Shawano County Board of Supervisors in session this 24th day of February, 2021, that it does hereby approve the expenditure of a sum not to exceed $25,000 from the contingency fund to contribute to SCEPI to help fund this countywide comprehensive market housing study, submitted by the Executive Committee.
Motion to approve, motion by Bill Swatala, seconded by Rick Giese. Basically, Peter came to us from SCEPI, and there has been a need and requests for housing studies. Would you like to come up, Peter, if there's any questions or comments you would like to make?
Thank you, Chair. Thank you for having me. Yes, we're in the process of doing a housing study for the County of Shawano, and it is going to be fairly expensive and comprehensive. SCEPI is contributing $15,000 to this effort, and to date, we've got the following communities to sign on to also contribute money to the study. The Village of Bonduel, the Village of Wittenberg, Tigerton, and Gresham. Also, the City of Shawano has signed on. So we're looking to do a study because we have a housing shortage in Shawano. We have comprehensive plans that call for housing, but we don't have any market studies that will show that developers can come in and develop housing in the community. This came to a little bit of a head earlier or late last year with the Swiderski project and the need to develop a market study for Swiderski for them to go ahead with their housing. We do know now that many of these communities would like to be building housing, but we can't go to developers and recruit them unless there is a market study showing, yes, if you build it, there is a market here in Shawano County for you to sell your homes. And the real estate market is still hot. If you saw the report from the realtors that came out earlier this week, January once again was record home sales for the county and record prices. We just need to develop more housing. We need more developers in here to build our tax base and to get some net new construction dollars going. So,
And if I remember right, Peter, the main reason for this housing study is the developers will not get any funding from their investors or financial institutions unless there's a housing study done to show the housing need in that area.
that's correct. To determine the market, to give them the market value, and that's what we had to do for Swiderski. But I work for Shawano, so a lot of the investors don't trust us. They want somebody from outside the area to validate it. So that's why.
Yep, somebody completely abstract to look at it.
Yeah.
Okay. And we thought that we would take the money out of the contingency fund because that was not needed yet. And we thought it wouldn't take too long if we do have any developments like that in Shawano County that we would receive the money back in the tax base increase. Deb Nofke.
Okay, you may have answered. Sounded like wind or rain. Still
No.
sounds like wind or rain. Okay, you may have answered some of the questions, because my first thought was, why would we spend 25 grand for a study that's going to tell us exactly what we already know? Good, affordable, decent housing, we are really in bad shape for. Even crappy housing, we don't have a lot of.
I completely agree, but without the study, investors and finance people and the banks, they just don't believe us.
Okay, is that it,
It
Deb?
just, I don't know, I got this feeling like somebody's pulling my leg here on that aspect of it.
Okay. Oh, John Ainsworth.
Just out of curiosity, and it probably has nothing to do with this particular resolution, but a few years ago, we heard about all kinds of grandiose plans on the old hospital property. Is something still alive, or is that completely gone, or what's happening?
Actually, there's development occurring there, and that's why I think the housing study is going to be a good, will help us a great deal. Vans out of the valley is currently got 3 parcels under construction. 2 of them, the foundations were poured and the lots and the buildings were sold. So we've seen some movement in that area that we know that once the buildings are started, they're being sold. We just need to encourage more developers in. And I have developers coming through my office on a weekly basis. They said, if you have a study that I can bring to my bank, I have the investors and the bankers.
Okay, is that it, John? Dennis Knack.
Between all the contributions from the villages and everybody else, how much is the study, how much money do you have? 15 from Skeppy, 25 from here. How many thousand is it going to cost?
The studies that I've looked at in the past, Door County did their study 4 years ago. That was $44,000 for their whole study. Manitowoc and Sun Prairie just went out for studies last month. They're not back with the RFPs. They were expecting between $50,000 and $70,000 for their study. I think the important thing to remember, though, I didn't mention this, Skeppy has also set aside money so that once we have the study, we can market it to developers. Because the study is only as good as we can get people to come in and to build. So we do have some money set aside to bring developers back into the county in September, October, that timeframe when we get the study back, to show them places to build and the type of properties that they can look to build.
I got the same feeling Deb did, you know, somebody's pulling our leg. But.
Okay. Sandy Stanky.
I guess I was under the understanding that we have, I'm over here, 3 condos or spec homes going up, actually where the old hospital was. Plus there's 2, if I'm not mistaken, out on Waukesha, or you can see them from Waukesha. And I was also under the understanding that Swiderski is already got a spot to start there. Is that not true?
Vans is doing all those projects that you mentioned, and they took a risk, and they did that with their equity. Swiderski, I spent the month of December doing a market analysis for them to get their, to help them get through with their financial institutions. If they would have had that study, and Swiderski is a really good developer, and they don't go any place where they're not going to make money.
No, they're at a Cronenweather, correct?
Yeah, and you know that they are really good. I've seen a lot of their projects, and their bankers didn't believe them about Shawano because we don't have any comparables to prove in the last 20 years. Well, who's built 200 units in Shawano County in the last 20 years?
Okay, is that it, Sandy?
Yeah.
Okay, well, I see no other questions for Peter. So I guess if you are in favor of resolution number 10-21, you would vote yes. If you are not, you would vote no.
Thank you.
Thank you, Peter. 23 yes, 1 no, and 3 absent, so the resolution has passed. Item number 17, resolution number 11-21.
To approve creating the position of Assistant Zoning Administrator and for reorganization in the Planning and Development Department. Now therefore be it resolved by the Shawano County Board of Supervisors in session this 24th day of February 2021, that it does hereby approve the creation and authorization for the hiring of the position of an Assistant Zoning Administrator within the department. The Assistant Zoning Administrator shall have the duties, staff supervisory responsibilities, and serve with the classification and assigned pay grade and step as detailed in the attached personal action requisition/authorization. Be it further resolved that the Executive Committee shall approve the job description for the Assistant Zoning Administrator position and update the department organizational chart according to the attached Planning and Development Organization Chart with the property lister duties now placed under the duties of the Department Administrator, submitted by the Executive Committee and the Planning, Development, and Zoning Committee.
Is there a motion to approve? Motion by Gene Hoppy, seconded by Richard Perfecki. Are there any questions or comments? I will, the PD&Z committee appointed Jess as the interim department head there right now, but she is unable to attend today. And I can speak, I guess, quite well to it because some of this was my idea. The majority of it was to try and revamp things in the PD&Z department. And there is a tentative plan right now to combine the top, basically administrative duties to Jess and combine that job with the property lister. And then this would take up some of the other duties. So if this happens and there is a assistant zoning administrator, the zoning administrator's job would be shrank down somewhat and divided up between 2 people. And the funding, I changed I added, I should say, to the fiscal note because Nita had the one fiscal note in there, and that would be the worst case scenario, was the one that she had in there. For this year, there should not be any additional funding required to make this move because of people being gone and salaries, and there was some money moved ahead from last year, some carry forward money. So with that, are there any questions or comments? Deb Nofke.
Is this just becoming, that everyone's becoming aware because we have an interim? Or if this had been fixed, would Andy still be here?
I don't know. I can't answer that. Some of the problem that they're having in PD&Z is having people that have any interest at all in zoning and obtaining the necessary licenses that there are for issuing sanitary permits and reviewing sanitary permits. And it's not a very easy thing to pass. And the number of people that do it are getting quite limited. And we're hoping that this would possibly change that position around to where we could have somebody that would be more interested in just that and not the administrative duties. Does that make any sense to you, Deb?
Yeah, it seemed like Andy always had too much on his plate. And I'm just looking at this as, would this have solved that? I don't know.
Well, it's actually the number of people isn't the problem. It's the level of experience. And when that all last transitions happened before, and we had Andy in that position, Andy was stuck with 2 people there who had absolutely no training, no licenses of any type, and he also became the department head. So he got them duties, plus he had to still keeping his same duties as before. And I don't know if this will completely answer that problem, but splitting them duties up will possibly alleviate one person having so much responsibility. That answer your question, Deb?
Yeah, I think we're undoing things from, I don't know, Reed days, which is probably long overdue.
Yeah, and like I say, the others, there will be additional funding required in the fall when we do budget, but we'll work on that then. And this year, we did have a large surplus. So, and we don't intend, and PD&Z does not intend, correct, so just add another position. Okay. Is there any other questions or comments? Steve Keats.
Then again, this is also replacing, if Jess would have had to take over the whole thing, we'd have to find a replacement for her old position, and this is basically just taking that one at one's place, because she's gonna retain her property lister position as well as being the executive, so.
Correct, because that's how most of the funding will be for the rest of this year, because if you split that job up between two people, we're gaining one job that isn't being paid. So that would fund the majority of this for this year. Any other questions or comments? Okay, seeing none, then if you are in favor of resolution number 12-21, oh, excuse me, I've got to back up a little bit. 11-21, you would vote yes. If you are not, you would vote no. The resolution has passed, 24 yes, 0 no, with 3 absent. Moving on, resolution number 12-21 to approve. Pam?
To approve additional amount not to exceed $13,037 from KIP sales tax for the PLSS 20 project. Now therefore be it resolved by the Shawano County Board of Supervisors in session this 24th day of February 2021 that it does hereby approve the expenditure of an additional sum not to exceed $13,037 from the KIP sales tax account to fund the PLSS 20 project, submitted by the Capital Improvement Projects Committee.
Is there a motion to approve? Motion by Steve Geets, seconded by Devin Crejon. Steve, you wish to comment?
Yes, we took bids. This is for the replacement of the corner markers, section corner markers and so forth. We had 50,000 requested for a KIP project for Town of Herman and Town of Pella, I believe. And the lowest bid came in at $63,037. That's why the additional $13,037 is needed, so.
And for the new members, so you know what this is, there's monuments buried throughout the county on like section corners, and that's what surveyors go back to and find when they're doing any surveying. And at times they freeze, lift up, and a grader hits them and they disappear. And that's what this is to go back through again slowly across the county and reset all of them that are there, or check and make sure that they're there and they're easy to find. So it can avoid a lot of conflicts, put it that way. Is there any questions or comments? Seeing none, we have a motion to approve then. All those in favor say aye. Oh, excuse me, we got to vote. I'm trying to hurry up, but I'm hurrying too fast. If you are in favor, you would vote yes. If not, you would vote no. 24 yes, 0 no, with 3 absent. The resolution is passed. Item number 19, report by the Finance Committee.
General accounts listing for bills paid in the amount of $1,202,597.17.
Is there a motion to approve? Kevin Conrad, seconded by Randy Young. Is there any questions or comments? Okay, seeing, oh, Dennis?
I had a question on the last three, Wisconsin County Mutual. Are we self-funded in auto insurance? We're self-funded in workman's comp.
The, some of the line items that you may see on there are, there was a few things slipped through the cracks. Put it to you this way. The city and the county, it was kind of vague of who was really in charge of what at the airport. And some of this, I believe, is a result of when Brent was here, he had made an agreement, and they came to an agreement with the city that everything would be underneath one roof instead of the city trying to insure a piece of this or a piece of that at the airport, and the county would insure a piece of this. They come to an agreement that everything would be underneath one roof and that the county would handle it. And I know that to be true because when this issue first came up and Brent was gone already and me and Tony were kind of fishing around, that we called a couple of different people and we got exactly the same answer out of them. So it's not anybody trying, it wasn't to pull anything, that's actually what was discussed and what was happening. So I went through and we made up a list of assets at the airport and we turned them into the insurance company to get insurance on them because there wasn't any. From January 1st until I would say about the end of January, early February, it just slipped through the cracks. There was no agreement with the city. There was no insurance on anything out there. And that's where this is coming from. A lot of this, and the city will reimburse the county per the agreement 50-50, the same as we do any other costs out to the airport. Does that answer it, Dennis?
Yeah, I think so. This 130-some thousand then is for the year premium.
I will have to look again, Dennis. It shouldn't be, it shouldn't have been that much.
It's 53 and 53 and 27.
Oh. Oh. Auto insurance and liability insurance, okay. That we would have to get back to you with Dennis, because these are too larger figures to be just what's out there at the airport. That would be a much smaller amount. Richard Fecky.
Yeah, when I checked with finance about that, I guess Brent Miller at the time, he set up a deductible that the county would pick up the first 27,000 of any deductible in the county, and the rest would be picked up, I believe, by State Farm or State Mutual, I believe.
Or Wisconsin County Mutual.
Right, so we're liable for first 27,000.
That-
The reason this came up is that the Human Services meeting, there was a couple bills on there for replacing windshields, and that's where it started from. And that's what I found out before Anita left the county, so.
Okay, and that would definitely make sense for that one, Richard, because I know when the issue came up in Highway, when there was the fire at the schoolhouse over here in Heritage Park, of who owned what, and deductible, if I remember right, at that time, John, was 25,000, is what we were discussing always. And that was the first 25 the county had to pay for, so that would cover that one. But I will find out what that other 53 each is going to County Mutual. Because we still do have a lot of auto insurance, even though we do have leased cars. You're gonna have, I believe, Health and Human Services has a bunch of their own cars, and there's other vehicles that probably fall underneath this. I'd have to check to make sure, but I believe there's gonna be some from Highway of the pickup trucks and, smaller vehicles like that. That'll be through them.
Veterans, his bus or van or?
Yeah, so I would assume that's where these charges are, but we can find an answer for you if you would like.
I'll take that as a due out, Tom. and dig into
Okay,
it.
sounds good. Is there any questions or comments, other ones? Seeing none, and if you are in favor of paying the bills, you would vote yes. If not, you would vote no. Twenty-four yes, 0 no, 3 absent. Okay. Item number 20, acceptance of the committee minutes. Is there a motion to approve? Motion by Aaron Damrow, seconded by Gene Hoppy. Is there any questions or comments on the committee minutes? Seeing none, then we can do this by acclamation. All those in favor say aye. Aye. Opposed, same sign. Motion carried. Special order of appointments. I would assume we can just do these all at once. These are the emergency fire wardens that were submitted to us.
Right, by the DNR. They used to always submit them in December, but now the last couple of years, it's in February. There used to be quite an extensive list, but now, the past few years, there's only been 3 people, so.
Okay, and they're looking for approval of Joanne Costelny, I believe, from Plain Sense Country Meat Market, the town of Grant, Nikki Buss, Coach Light Bar and Grill in the town of Westcott, Terry Easker's Town and Country for the town of Wittenberg. Is there a motion to approve? Motion by Mark Boland, seconded by Dennis Knack. Is there any questions or comments? Seeing none, then if you are, we can do this by acclamation also. If you are in favor, you would vote aye. Aye. Opposed? Same sign. Motion carried. Item number 22. Board member comments or new business? Okay. Richard Perfecki.
Yeah, I'd like to have this drug court deal on next month's agenda while it's fresh in everybody's mind. And as long as we're late for supper anyway, I'd just like to read you something to keep something to think about. It'll only take me a minute here. Okay, in the comment, we'll just say this person's, his name was Little Johnny. He started stealing grandma's pills from her medicine cabinet, first of all. Then the parents took his iPad away for 10 days. Next, Little Johnny got caught again, went to court. The judge gave him a $100 fine and to be supervised under his parents. Next, Johnny was stealing from the neighbors to feed his habit. Next thing, Johnny was given a job by the drug dealer, which he took to feed his habit. Next, Johnny got 10 more of his friends hooked on drugs. And then also he was making a lot of money at the time and bought himself a fancy sports car. Next, Johnny went speeding down the highway, being chased in a high-speed chase. When the car pulled out from a crossing, he killed 4 people, and he went to court and got life in prison, causing the state to lose $1 million or more. What did the county or the state benefit by letting him slip through the cracks? I think we have to quit making excuses and work together and make it succeed. That's all our responsibilities as elected officials, including DAs, judges, no respect. Thank you.
Okay. I We'll see, Richard, how the month goes. I don't know if it warrants bringing it back up to the board next month already, maybe possibly a little report if there was any action or any progress made. But it's not going to be an easy issue to fix because the judge doesn't really report to us and neither does the district attorney. And it seems like there's quite a difference between the sides of everybody involved of just what they can do and what they can't do.
But the trouble is, this has been going on for a couple of years already, and Human Services, the people that got working on it, they're just spinning their wheels and they're not getting any cooperation, and this isn't gonna work.
Yeah. Okay. Aaron Damrow.
I guess I looked through previous board meeting minutes for the last couple of years, and I was just wondering when the district attorney's office gives its annual report. I see that all county departments that are county funded give an annual report, and I have not seen an annual report from the district attorney's office.
Elected officials don't give annual reports. None of the elected official offices have
The
annual
sheriff's
reports.
department does.
The other ones don't. They stopped that, I know, like for our office, they used to do it, but then it's stopped for probably at least 10 years.
Well, my feelings are that it's our criminal justice system is one of the most expensive parts of our county's tax dollars. And we get a sheriff's department annual report, and I do not believe that the district attorney's office is doing its job. And I want accountability and transparency in what's happening and in getting done. And if other county departments give an annual report, it's my opinion that the DA's office should have to give an annual report too. So that's just my
Okay.
comments.
Deb Nafke.
Okay, Pam, do you record the meetings? Do you do
Yes,
an audio
it's on the
recording?
website. It's on the website. It might be a little misleading because it's under county, videos, but it's the audio.
Okay, but you do have the audio on there?
Yep.
Good, because I am in receipt again of another anonymous open record request. And
Take them to court counsel.
I know, but I don't want to dump this on Tom. So here's my response. I do not have a county-issued cell phone. I do not have a way to take pictures with a cell phone and text them to anyone. Even if I did have these records, which I don't, I am not the legal custodian or the custodian in any manner of these records. And now I will give this whole packet to Tom. Sorry, Tom, it's a
Okay.
long story. But, I mean, I have a request to text an answer, and I can't.
No.
And nor will I be baited
No.
into violating an open record law by going in any backdoor texting.
No, that's fine. I wouldn't even respond if I was you.
By law, you really should, though.
No, that's up to corp counsel. And we've
Okay.
been addressing this issue for quite some time already.
And to take it a step further is that this is probably what really set it off. But another member had some questions about, because I was going to be nice and at least look up the links and provide them, and say during this little spiel and tell the open record requester, this is where you can find them. And I also have sat in a couple committee meetings where somebody's asked about different policies that we have. And so I was going to go find the links for those as well, and I find that they've been scrubbed off the county's website. Why? I mean, we're talking specifically about the policy and procedure manual, which references policy 13, references our asset disposal policies, so that at least you have an idea of what you're looking for, and they're gone. Shouldn't every new board member, because they're for the board as much as they're for the elected and employed contingent here, shouldn't we all have access to that?
Okay, we will check into that. But as far as your open records request goes, do you have a name and address of this individual? I'm gonna do the same
No.
thing to you that I did to this individual once before.
No,
You don't have a name and address?
no.
Okay, so now if I fulfill your request and somebody like you requests that again, what am I gonna tell them? I got an open request, somebody requested this, so I told somebody something.
Right, and that's why I
That's why you
cannot-
gotta have names and addresses.
I
And
can't respond to it. I don't have
That's
the-
right.
the
So that's-
ability.
That's what you do with
There's
it.
a
You just,
text number.
don't respond. That individual refused to identify himself, and it don't work that way. You gotta, if you want information, gotta fill out a request, not just start sending texts. Any other board member comments? Okay, seeing none, then I believe we have the claim report.
For today's meeting, paying 27 members, the total amount is $2,476.96.
Is there a motion to approve? Motion by Devin Crejon, seconded by Kathy, oh, I'm sorry, Kathy. I keep forgetting, you're in the seat. You're always in the seat, that was always his job when he was here. Seconded by Kathy Lupke. If you are in favor of paying the per diems for today, you would vote yes. If not, you would vote no.
Devin? Devin?
Yes, 22, 0 no, and 5 absent. He wasn't sure, so he was checking with a veteran, Mark, behind him what to do. Okay, folks, next meeting date, March 24th, 2021. Put it on your calendars. Item number 25, a motion to adjourn. Kevin Conrad, seconded by Kimberly Leffel. All those in favor say aye. Aye. Opposed, same sign. We are finally adjourned.